All right, welcome back for an afternoon session of the Judiciary. Hopefully I feel confident we're going to get back on schedule. We have next 23 LSO 114, child endangering controlled substance use while pregnant, Mr. Fuller. Oh, Mr. Hopkinson. I don't know if I've ever heard you present a bill to me that wasn't a blockchain bill. Has he done Judiciary once? No.
Been here before.
Thank you. Thank you. Go ahead.
Thank you, Mr. Chairman. David Hopkinson with the Legislative Service Office. Here to walk through 23 LSO 114, Working Draft 0.4, Child Endangering Controlled Substance Use While Pregnant. This bill is before the committee from the last meeting. The committee considered it as an individual draft, decided to vote to have a version made for the Judiciary Committee itself, based off of House Bill 85 from last year. I wanted to, in walking through the bill, the version that the committee saw at the last meeting is slightly different now. The reason for that, I'll kind of highlight those points. On page 2, the new subparagraph C, or what this bill does, would be to create a new crime or a new offense for consuming controlled substances while pregnant. That offense is noted there at the top of page 2, that no person while pregnant shall knowingly consume methamphetamine or a controlled substance that is a narcotic drug unless prescribed by a licensed healthcare professional. Where this bill differs is in the staff comment on page 3 and in the last sentences there on page 2. As drafted, the bill would provide that for a first offense under the subsection C, which is the new section, that it would require the court to sentence a person to a term of probation, require that they obtain an addiction severity index assessment and an American Society of Addiction Medicine evaluation, and complete appropriate treatment, and provides that the court could sentence them or could enter a deferred sentence in accordance with Wyoming Statute 713-301 and 35-7-1037. The original language that the court had seen in May is in that staff comment in red. And I wanted to highlight a couple of points there because that language uses notwithstanding any other provision of law. So the reason for the change primarily was an attempt to clarify, because there are some, I think, open questions as far as what the intent of the committee would be, some policy questions that are still open. Specifically, one, should a person be able to receive multiple deferrals under either 1037 or 301? Should a person be able to receive a deferral regardless of prior unrelated convictions, because there are restrictions on who qualifies based on prior convictions, as well as a question of should a person, specifically looking at 713-301, requires the state's consent. So as a policy question, to obtain a deferral, is the intent to have the state consent to that deferral, or would the court be able to enter it on its own? On page 3 is just some conforming language, a conforming amendment to 35-7-1037, which inserts on page 4, lines 5 through 7, the new crime to include that as a possibility for a deferral under 35-7-1037. And then on the last page, just to highlight that this draft does not specify an offense, a punishment for the offense. And so Wyoming statute would make that a misdemeanor punishable by not more, specifically for a first offense, punishable by not more than 6 months, a $750 fine, or both. Another policy question as well is whether the committee wants to make this offense expungible. As currently drafted, a felony conviction would not be expungible. With that, I would stand for any questions on this bill.
Committee, questions for Mr. Hopkinson on the construction of the bill? All right, thank you very much, Mr. Hopkinson. I I know we have, some folks signed up online to testify. And we want to hear from, well, no, I'm just trying to figure out if probably our Department of Family Services ought to go first. Director Schmidt. That's what I was trying to figure out, because earlier when we were on child support, I didn't see you in the room, so I wasn't sure if you snuck back in.
Thank you, Mr. Chairman, Madam Co-Chairman. My name is Corin Schmidt, and I'm the Director of the Wyoming Department of Family Services. And I'm not here to necessarily speak to the bill, but to update you a little bit on some of the activities that the agency is required to undergo per federal legislation. And in previous testimony throughout, I don't know, the last year or so on this topic, we've alluded to it a few times, but there's never been really a chance to talk about in the full context of what we're doing and what our plans are moving forward. So there is federal legislation that's called the Child Abuse Prevention and Treatment Act, CAPTA, which has been one of our federal requirements for a very long time. But in 2016, there was an addition to that federal legislation called CARA, and it's the Comprehensive Addiction Recovery Act. And it was a response by the federal government to substantial increases in substance use across the US, and specifically how it pertains to child welfare. So as a requirement of that federal legislation, they are asking states, they are mandating that states look at developing policies and procedures to attempt to address from a prevention standpoint and from somewhat a healthcare standpoint, parents, moms who are using or babies that have been born with substance exposure. So we got off to a slow start back in 2016, and then COVID hit, but now we are fully working with numerous partners in regard to developing policies and procedures that will help us, one, identify moms, babies who are potentially exposed or are pregnant and are using, and then two, set up protocols, policies, and practices to help us intervene with those parents so that we can get them into the services that they need. The whole item is called a plan of safe care. And it will be, the process for incorporating plans of safe care will be very community-based. But the idea is that we have a statewide structure through the partnership of many entities that are interested, a lot of them that are in the room today, but looking at home visitation, looking at healthcare providers, looking at mental health and substance providers, et cetera, that when they identify a mother who is using or potentially a baby that has been exposed, that they can engage that mom with services so that if mom is pregnant, for example, she can have a healthy baby and hopefully stay clean through the rest of her pregnancy. So I provided very quickly yesterday electronically a handout, and I think you all should have it today in front of you, and it just says plans of safe care. And this is just a really fast tutorial on what it is. The substance of what we're doing, though, has really come in the last year through some technical assistance we're receiving through the federal government. And it's been really in the last year that we've made some good strides on this. We've identified 5 pilot sites, and through some of our contractors that provide home visitation, we'll be looking at setting up community-wide protocols so that, for example, if a hospital identifies a mom or perhaps a child that's been exposed in utero, to contact us or contact potentially a provider, somebody who can come in, work with the mom, work with the family, get them set up in a kind of a treatment plan so that we can continue, hopefully through DFS, working voluntarily with that parent, or if there's no concern about abuse and neglect, working with community providers to continue providing treatment or whatever services they may need. So during the course of the next year, we'll be working closely with those pilots. And then once we have those protocols in place, then we'll be looking at expanding them to the rest of the state. This may be with public health nurses. Currently, we use parents as teachers, but it's not just limited to those two entities. Any type of organization that's interested in engaging with these moms, with these families, we will work with them to set up training so that they can incorporate a plan of safe care. But ultimately, it is the Department of Family Services' responsibility to ensure that that capacity and that availability of those services exist in every community. So it will eventually be statewide. And I could go on and on, but I think that was a really good 10 minutes or less overview.
Yeah, it's a good stopping point. Representative Oakley.
Thank you, Mr. Chairman. Director Schmidt. So I just kind of, I've been looking at this, you gave us a handout on plans of safe care. And then you just mentioned that CAPTA has been around for a very long time. It looks to me like it was 1974, when it became a federal act. And at that time, and since, again, in 2003, it required each state to appoint an agency and grant it legal authority to investigate and prosecute incidents of maltreatment. And so in looking at the history of that over and over and over, it said to give the states, to require the states to be addressing this issue. So I guess one of the questions I want to know is, where are we now? I mean, I know you just told us about this new initiative. I mean, what has been and what is the policy of the Department of Family Services, reporting requirements? Again, so looking at 2004 under CAPTA, there were 4 elements that were required for substance-exposed births. And I noticed number 3 of that was develop a plan of safe care. So we're looking at it in 2021, 2022. It was required to be handled clear back 2003, 2004. So I guess what I'm looking for, that I just somehow, I don't know whether we're talking around it. I know nobody's trying to do that, but what is the reporting requirement? What has been done? What was in place for Wyoming? I mean, again, so this was required via CAPTA specifically for substance-exposed births since 2004. And then and I understand, I mean, governmental, but it just seems to me now, even reading this, so then there was an update again in 2016. That's been 6 years ago. So then I hear, well, 5 years later, we did we created a team again so we can study it for a 24-month commitment to work with experts to find policy. I mean, maybe that's why we're here, right? We're trying to define policy, and maybe we're going down the wrong route. I've certainly heard that from many members. But tell me what's in place and what has been done, since this has been required since at least 2004. So if you have any history, or if you have any, like, what the current requirements are, I'd like to hear that.
Director.
Mr. Chairman, Representative Oakley, so I think there's a lot of questions in there, and let me try my best, so prompt me if there's something that I'm missing. But in general, CAPTA is captured through our Title 14 statutes around abuse and neglect. So we investigate abuse and neglect when allegations are made to us for what meets the definition of abuse and neglect. So that's how we've addressed this since the beginning of CAPTA. What's a little bit different about the 2016 is kind of taking that a little bit further out and bringing in community. So internally, we've been addressing this issue for a very long time. I mean, we have upward of 35–40% of our cases that involve substance abuse. So substance abuse in general is not new to us, and we've addressed it through all of our various policies and procedures, and certainly referrals. What's a little bit different, I think, about CARA and, previous legislation before that is it's really a concerted effort by at least the federal mandate for us to work a lot closer with our healthcare systems, including getting reporting from local hospitals, for example. Hospitals are not required to report to us if an infant is born with some sort of exposure. They report to us if they have concerns of abuse or neglect or maltreatment or immediate harm. So you could potentially have a parent who has tested positive or has been suspected to have smoked marijuana or ingested marijuana. The child may turn out to be positive for marijuana, but that in and of itself may not result in a DFS action, because once that child is born, is there any risk of that child to be any risk of maltreatment or neglect of that child? So it gets really complicated when you start to pull in all of the hospitals and the healthcare providers. What this suggests is doing a better job, and I agree with it, doing a better job in connecting with our healthcare providers, with the other resources to say, we don't want to have a mom who is using while she's pregnant, because what we know is that there's risk of abuse and neglect. We know from a healthcare standpoint that there may be some risk of a pregnancy that maybe isn't healthy. So an earlier intervention in our minds then would help with that. This is one way to get at it. I mean, there's obviously with this legislation, there's a lot of ways to address this problem. I just wanted to let you know that we are working on something that does kind of get at some of the issues that this bill gets at through federal requirements, and that we're working on a lot of local policies and procedures to help with that.
Go ahead.
Thank you, Mr. Chairman. Director, do you have any numbers for us? What are we looking at? I mean, in Wyoming, trying to quantify what type of issue we're talking about. And I'm not talking about all substance abuse. I'm talking about this specific issue. What what, if anything, do you know about numbers for meth or hard narcotic drugs and pregnancy and children, infants that are born and affected by it?
Mr. Chairman, Representative Oakley, so this is old data. This is calendar year 2021. When we did, and it's very difficult for us to pull this data. It's really kind of a case-by-case review, just because of the way the system works. So at the time that we looked, we had 113 open cases dealing with issues of substance-exposed infants, which involved 115 infants. But of the 100...
Sorry, are you looking at something that we by chance have or that you sent to us?
Mr. Chairman, this is something that we presented during legislative committee hearings during the session when this bill was presented previously.
Okay, so somewhere. Go ahead, can you just start over with those numbers?
Sure. Okay, so in calendar year 2021, we pulled some information just to be prepared for conversations when this bill came up during this session. What we knew in calendar year 21 is we had 113 open cases. So this is a point in time. As of calendar year 2021, 113 cases. Of those cases, in 64 reports, or 57%, it was noted that THC was present, so marijuana. In 55 reports, or 47% of the cases, there was meth. In 9 reports, or 8% of the cases, there were opioids. And then the remaining was a variety of different things.
So when you say the remaining, there's not an overlap in those? Those are distinctly 64 THC, 55 meth, but they're not some in the same?
Mr. Chairman, yes, they could be some in the same. So they could be repeated. So you could have one case where one case that it had a report of THC and meth.
Okay. Go ahead, Representative Oakley.
Thank you, Mr. Chair. So then taking those, let's just talk about then the 55 cases of methamphetamine abuse while pregnant or with this infant. I know this is kind of hard. I mean, what was done? I'm trying to get at results. You know, what do you have? How do you follow that? Because this to me gets down to the heart of it, which is if they choose not to get substance abuse help. I mean, we've had this long discussion this morning about how CAST is successful, and honestly, ITU is successful. What do you have for numbers on compliance once they were a case was opened with them?
Mr. Chairman, Representative Oakley, I do not have that. Any of the outcome data as it relates specifically to those 113 cases. What I do have is that of those 115 infants, so 113 cases involving 115 infants, 37 or 32% were placed in foster care. In addition to that, we had 5 siblings. So because of those cases, we identified 5 siblings that also needed to come into care. So for example, mom has a baby, we take baby into protective custody. There's other children in the household. The issues surrounding that family merited bringing those children into protective custody. So I think that's just important. I don't know of those then how many were returned within a certain amount of time. But certainly I can give you some overall information about how many children are returned to the home and how many cases we close successfully. We have a really hard time teasing out the substance abuse specific data.
Thank you, Mr. Co-Chair. Thank you, Director. I remember in the session hearing you testify that hospitals are not required to report when an infant is born drug addicted or drug exposed. Do you know why that is and why that's not considered, you know, is that not considered abuse, or what's the disconnect there?
Mr. Chairman, Madam Co-Chairman, it's not listed in our statute specifically that a baby testing positive for a substance is automatically abuse or neglect. So we have kind of a laundry list of what those things are, and drugs can be listed, but there also is the determination made as to whether that child's in imminent danger and whether that child is warranted removal. One of the issues we would like to, that we are discussing through the plans of safe care is working with hospitals, working closer to have that information reported to us. It doesn't necessarily mean that we would investigate if it doesn't rise to the level of investigation, but we do not have any, excuse me, statewide data that would tell us how prevalent this is, back to your example, Representative Oakley. And we are one of not that many states that don't require that kind of a reporting.
Co-Chairman.
Could you restate that, Director?
Mr. Chairman, Madam Co-Chairman, I believe that we are
One of few that don't require the reporting?
right, one of
Okay.
like 14, I think.
Okay.
I think there's somewhere around 30, 35 that do require some sort of reporting.
And then just, I think for the public's understanding and the committees as well, I think a lot of people would assume that if a baby is born drug exposed, that is child abuse, right? Automatically. What factors would be considered or evaluated that DFS may not take further action, or medical provider doesn't feel they need to report? Because I think they could, because they certainly could under that mandatory reporting of child abuse statute. And so there's still this perceived discretion out there. And so help, I think, everyone understand what those circumstances may be. And I know it's not your call, but helping understand what that looks like on the ground for those professionals choosing not to report.
Mr. Chairman, Madam Chairman, one of the examples where possibly they would not report would be if you have a family, for example, there could be a spouse involved where the spouse is more than capable of taking care of the baby. That making a report, if mom, for example, has been clean in the last few months of her pregnancy, but tests may show that there was some use, like is the case with marijuana, then there's still a capable family member to take care of that baby. So it doesn't warrant necessarily removal. And I think it's helpful to remind the committee that the Department of Family Services does not have removal authority, which means that we cannot engage with a family, make a determination the child needs to be removed and then remove. That is a decision that's made by law enforcement or by medical professionals. And luckily, they call us and consult with us in many jurisdictions before that decision is made so that we can help walk through what our rules are and then certainly what we would do in terms of an investigation. We also have available voluntary services, and that's really what, over the past couple of years, trying to help more families voluntarily so that their children do not have to come into protective custody. And this would be a situation through plans of safe care where we would like to work with families voluntarily so that children don't have to come in care if there's no reason for believing that there's imminent danger to that child.
Representative Provenza.
Thank you, Mr. Chairman. Thank you, Director. So to kind of add on to that point, if it sounds like the current process without that felony child endangerment law, you can kind of take into account all these other variables. If someone were to be charged with, say, a felony of child endangerment, does that then, how does that impact your decision in determining with DFS? Does that maybe force your hand in having to make a decision to remove a child or not?
Mr. Chairman, Representative Provenza, that gets a little bit technical, but when we are engaged voluntarily with a family and we know of pending criminal charges, we will investigate that allegation for abuse and neglect. And then oftentimes we will hold off on any type of determination until the criminal charges or if there's been something legally that or criminally that has occurred. It's mostly our policy that we defer to the criminal charges first because the burden of proof is often higher. And so while we could substantiate, we can investigate, sometimes by doing that, we may put the criminal case at risk. So we usually hold off on any of the Title 14 type of substantiations or determinations based on what happens at the criminal level.
Thank you. And Director, if you know, this may not be something you know, it's curious to me, obviously a drug test has been done on these infants. Do you know what triggers a drug test to be done on the infants? Obviously, there's a suspicion by a medical provider that drug use has been occurring. So then that's not child abuse that needs to be reported. It's just kind of curious to me, the process in place.
Mr. Chairman, Madam Co-Chairman, my understanding is that it's based on the protocols of the hospital of when to test. There's no universal screening process in place across the state. So it would be left to the discretion of the medical professionals. So I would defer to them on how that decision's made.
Nothing else for the department. Okay. Oh.
Thank you, Mr. Chairman. In this plans of safe care conversation, you talked about having hospitals and stakeholders involved in terms of what the plans are moving forward. So are hospitals now working with some of the folks across the state and with Department of Health, and it sounds like Department of Family Services, to kind of work on adopting policies that would be well handled in-house?
Mr. Chairman, Representative Provenza, yes, that's the idea, is that by working collaboratively at a state level, we can set a tone, but certainly my experience in the state is that all things happen locally, so allowing for local culture and processes to also play into it.
Okay. Thank you, Director.
Thank you.
Director Johansson, would you like to come on up?
Thank you, Mr. Chairman. Members of the committee, Stephen Johansson with the Health Department. I'll be brief and just echo what my colleague, Director Schmidt, said. We are certainly at the table with them to work on implementing this concept and this operation of plans of safe care. I will take full ownership that, as Director Schmidt mentioned, the pandemic and what that meant for our public health nursing offices, our county and local offices. We are delayed in this, but we've been renewing that conversation, as she mentioned, over the past year. I'm committed to making sure that Department of Health, Public Health Nursing is at the table. I know my folks in those offices want to do this work. It does come down to some capacity issues and some policy decisions on my part of how to operationalize it and what the best model is to incorporate this type of additional or layering of work into their day-to-day job in home visitation, in addition to the other priorities that I and that we give them. If I may, Mr. Chairman, to Representative Oakley's questions before, I was trying to pull it up on my phone. It might be helpful for the committee from the Department of Health perspective. We did some work for the Joint Labor and Health Committee. Since Management Council assigned this topic both narrowly here with this bill, but also broadly to the Labor Health Committee, would be more than happy to provide that data, mostly for our Medicaid mothers, as well as our community mental health and substance abuse data that we were able to pull together to give you a sense of what kind of volume we're looking at least a segment of the amount of births that we see every year and kind of what the scope of that problem is. I will say when you start to tailor and target more narrowly to specific types of substances, you get further away from what the broader issues are just from a numbers perspective in what for example, other substances and drugs like alcohol and tobacco being our biggest public health challenges just in terms of prevalence and use. So the numbers do get quite small. But I apologize, I was trying unsuccessfully to pull those up on my phone, but would be more than happy to share those with the committee for context. With that, Mr. Chairman, stand for any questions.
Vice Chairman Washup.
Thank you, Mr. Chairman. Director, could you share some information about what are the likely consequences of fetal exposure to methamphetamine, opioids, narcotics, and what are the long-term costs down the road for those children?
Mr. Chairman, Representative Washup, I will certainly defer to medical professionals that are either behind me, or I can certainly follow up with the committee from our health officer and our medical directors that we have in the department. But some of those issues can be significant depending on the severity of exposure. When severe physical and behavioral conditions that we've seen. Obviously, from the Department of Health standpoint, any access to treatment early, especially for using mothers or pregnant women, is a priority for us. We have vehicles and mechanisms to do that. Certainly not in a judicial or a punitive sense, but in a community access type sense. But Representative Washup, more than happy to have our medical folks follow up. I would be over my skis trying to answer that from a medical perspective.
Representative Yin.
Mr. Chairman, thank you, Director Johansson. So you mentioned that you didn't have the numbers exactly, but do you know what order of magnitude it varies between alcohol and tobacco usage during pregnancy versus other drugs during pregnancy?
Mr. Chairman, Representative Yin, I did until a few minutes ago. I apologize. I need to see those numbers, or I would be making corrections with the committee. But we'll follow up either today or first thing tomorrow to get you those numbers.
Okay. Co-Chairman Nethercott is diligently emailing it around to everyone as we speak, so you'll have it. Further questions, Representative Provenza?
Thank you, Mr. Chairman. Director, there were conversation about mandatory reporting, and I'm wondering what kind of the view is. I don't know if, I guess the department would have views on that, but what would be maybe the consequences, positive or negative, of mandating reporting of substance exposed infants?
Mr. Chairman, Representative Provenza, I'll be very general. The department doesn't take a policy position on that topic. That's certainly more of a law enforcement, and you'd be better served to hear from the perspective of the healthcare providers. It's a little bit of both worlds from my perspective, where certainly the richer any data source that we have and the more timely, the quicker we can act. We are in the Department of Health certainly limited to our populations. Generally, in terms of size and scope, that would be our Medicaid populations, where we do collect very granular data on the services they use, the diagnoses that our members have. So that's certainly a benefit. I think the other side of that coin is what the perceptions are among the populations that we serve of what the outcomes for them socially might be for seeking care, and what that reporting might entail, if that makes sense. So I'm certainly not trying to be dodgy with the committee. It's just what we hear from our stakeholders, our providers, and our members of those potential pros and cons.
All right. Thank you, Director. Director Shannon?
Mr. Chairman, Madam Chair, committee members, I'm Dan Shannon with the Department of Corrections. I just wanted to provide a report of what we're looking at as far as similar crime that's current within our Women's Center. As 64405 would be a new subsection or crime. Currently, number of inmates we have incarcerated under that legislation, and as well as they're charged with others. Currently, this would be as of September 2nd, is 95. We have 44 parolees currently under supervision with discharge, and we have 236 probationers. With that being said, I went back and I looked for the past 3 years of females that were incarcerated, that were pregnant when they were incarcerated, based under 64405. We had 5. We additionally had 4 additional women that gave birth while incarceration during that same time period, and they were under 35-7-1031, which is unlawful manufacture or delivery of a controlled substance. With that also being said, the proposed legislation provides an opportunity for probation prior to the first direct sentence to prison. I just wanted to provide you a few numbers, what we have. As of June 30th, so it's a little different than the September 2nd date, 93 out of 260 women in a women's center were incarcerated on a result of probation violation. So that was for that current snapshot would be 35.8%. So we have 93 probation revocations, 121 were under court commitment. Parole revocations were 10, and we had 16 other. Another would be transfers, interstate compact, things of that nature. Approximately 44 out of 63 were a direct result of substance use, or 69.8%. Mr. Chairman, Madam Chair, I stand for questions.
Representative Yin.
Thank you, Mr. Chairman. Director Shannon, could you repeat those numbers just once more? What percentage of the probation revocations were substance abuse? Was that in that set of numbers?
Mr. Chairman, Representative Yin, 69.8%.
Mr. Co-Chairman?
Yes, please.
Director, I remember hearing testimony earlier this morning that even in the most effective drug court treatment plans, that relapse is inevitable. Do you recall hearing that?
Mr. Chair, Madam Chair, I do not recall that, but I am aware it's potentially 5-6 times.
And so when you're talking about a pregnant woman who's using methamphetamine, of which on the 113 babies taken into custody from DFS, 55 were methamphetamine exposed. If they're on probation and the likelihood of relapse is high during that time, at what point during gestation exposure to methamphetamine causes a permanent result? Do we have any data on that?
Mr. Chairman, Madam Chair, I don't have that data, nor am I qualified to make that statement.
It was rhetorical. Thank you, Director.
You're welcome.
Representative Provenza.
Thank you, Mr. Chairman. Director, I know this has come up before in committee in terms of the services that DOC can provide some of these women. And so say of the 113 or half or 50 of them end up in your facilities, which I imagine would be a 50 number increase. Do you have the programs and services available to that increased number of women entering DOC under these conditions?
Mr. Chairman, Representative Provenza, regardless of the number, we're gonna take care of what we need to. With that being said, when I became the director, which should have been June of 20, we had 38 ladies housed out at Scottsbluff, Nebraska. I made a determination to make a movement throughout the department to realign. So at this time, we have 58 beds for our ITU for our ladies up at Newcastle. So that provided the space that's available. With that also being said, the mother-child program was never open because we didn't have security staff. And I charged our administrators that we need to take a different look at it. I looked at South Dakota, Georgia, a number of places, York, Nebraska, and there's no reason we can't run that program based on a programmatic sense, more of caseworkers that we can hire. It's more driven that way. So it's my anticipation to get that program up and running as well. So to answer your question, would we have space? We may have to house individuals out of state or out of county, but we're not going to say that we're not going to be able to take care of them.
Director, staffing is always a challenge for your line of work. How does that look currently?
Mr. Chairman, that's an understatement. I'm actually going to make a plea to the JAC for correctional officers, not for additional, but to increase a competitive wage.
Right.
I believe that that doesn't hold an employee. It's my responsibility to create a healthy work environment to make people want to stay and do the work. But we can't compete even with local law enforcement at this point.
How does that compare at the Women's Center to Rollins? Is it just as bad?
Percentage-wise, it's equal, if not worse, at this time.
In less scale?
Mr. Chairman, some shifts you're only running 6 officers, so you're comparatively that to maybe 36 at Rollins, but percentage-wise, we're actually worse at times.
Mm-hmm. Co-Chairman Nethercutt?
And so briefly, Director Shannon, as an opportunity to speak with other voting members for your budget request to JAC, what is the average salary of a correctional officer?
Mr. Chairman, Madam Chair, at 3 of our facilities, the starting wage is $17.58 an hour. And at 2 of our facilities, it's increased by $1. WSP, Wyoming State Penitentiary, is $19.05. With that being said, right now, Carbon County is paying I'm pretty sure it's $25.81 for a post-certified officer, which all our staff are. So we can't even compete locally with Niobrara County or Carbon County to buy many thousands of dollars.
Mr. Chairman, so I actually just saw a report on this from Wyoming Public Radio, and one of your administrators was quoted as saying that fast food chains are competitive with the Department of Corrections salaries. Is that an accurate statement?
Mr. Chairman, Representative Yin, yes, in certain locations.
And Mr. Chairman, if I can, Is there a difference between the compensation of the probation officers compared to the correctional officers? Because we've been talking about drug courts and this particular plan and where they would have an assigned probation officer either to a drug court or potentially to one of these women.
Mr. Chairman, Madam Chair, there is an increase, I believe it's around $46,000 per officer. With that being said, over the past year and a half, for the first time, we place applications and we're not receiving any. It's the first time that I'm aware of that we have a number of. We have 101 pro agents, probation and pro agents in our department. And right now, anecdotally, I think we have 17 vacancies, which is right around 20%.
Thank you, Mr. Chairman. And is it true still that probation parole officers require college degrees where your correctional officers do not?
Mr. Chairman, Representative Washington, that's correct, yes.
All right. Thank you, Director Shannon.
Thank you.
Doctor? Yes.
Mr. Chairman, members of the committee, Sheila Bush today with the Wyoming Medical Society, as well as the Wyoming chapter for the American Academy of Pediatrics. And with me, I have Dr. Louisa Mook. She's a pediatrician who works with Indian Health Services, and I felt like the information she can provide you would help inform and educate some of the decisions in front of you today.
Good morning or good afternoon. Yes, this morning was earlier now. I just want to acknowledge that there have been a lot of medical questions asked so far. I have addressed a lot of those directly in my testimony, but anything that I haven't answered, I'm really happy to address if there's something that's missing at the end as well. But hopefully this is helpful. As Sheila said, I'm Louisa Mook. I'm a pediatrician with experience in the care of newborns who are born with mothers with substance use disorder. I completed my medical degree at the University of Vermont in 2013, my residency in pediatrics at University of Washington Seattle Children's Hospital in 2016, and an additional chief resident year in 2017. Since then, I've been practicing rural pediatrics, both outpatient clinics and in the hospital. I've been a physician at Fort Washakie Indian Health Service since early 2020. Lucky me, right before the pandemic. I also take pediatrics call at Sage Westlander Hospital. The majority of my work in the hospital is newborn nursery care, where I attend high-risk deliveries, stabilize sick infants, and care for both healthy and sick newborns. I'm working hard to improve the health of babies in our state, especially when it comes to drug exposure. At Fort Washakie and in the hospital, we are using the most current evidence-based protocols for screening and treating infants born to mothers with substance use disorder. We hold weekly multidisciplinary team meetings on the Wind River Reservation in order to track and coordinate social services and medical care for high-risk children, including drug-exposed children. I'm also part of a collaboration with Primary Children's University of Hospital in Utah and Colorado Children's Hospital, working with child abuse and neglect specialists. These are the two medical centers that we send children to when their medical care exceeds what we can provide in Wyoming. The collaboration's goal is to improve medical care for high-risk children, including drug-exposed infants in regions with more limited pediatric medical resources. I'm also part of the hospital pediatric OB/GYN committee that reviews and improves the maternal child health care protocols in our hospital setting. I'm going to walk you all through a typical hospitalization for a pregnant woman with substance use disorder when she has her baby. When there's a known substance use disorder, poor or no prenatal care, or a prior positive urine drug test, women in labor are assessed with a urine drug test. The results are typically back within 24 hours. When the baby is born, we also test the baby. These results can take up to 14 days to come back, depending on the test used. The drug test done on the baby evaluates substance exposure at least back to the start of the third trimester. If the mother's drug screen is positive at the time of the delivery, the baby's physician discusses the results with the mom and notifies the Department of Family Services. And again, this is our protocol at our hospital, which is very different from other hospitals in the state. The hospital care that the infant receives depends on which substance the baby was exposed to. So opiate exposure triggers a withdrawal screening protocol and often a longer hospitalization. Sometimes babies withdrawing need to be transferred to a higher level of care for treatment of the withdrawal with medicine and a more specialized nursing team. But most often, because of our current protocols, babies do well and can stay in Wyoming. If the physician thinks that it's unsafe for the baby to go home with its mother, they will write a protective custody order, which removes the infant from the mother's care for at least 72 hours until a court hearing takes place. After the protective custody order is written, what happens to the infant is out of the physician's hands and is typically determined by DFS, the court, and whether corrective action by the mother has been taken to regain custody of the child. Wyoming is unique because only a physician or a police officer may take protective custody of a child. In every other state I've practiced in, this is left to DFS. I think it's better left in DFS's jurisdiction because as physicians, we don't always know what resources or safety issues exist for a mother, and we don't do home visits to really assess the safety of the home environment. If a physician does not take protective custody, then they must develop a plan of safe care. This looks different for each mother-infant pair. Generally, it involves frequent clinic visits to monitor the baby closely. DFS typically continues to do home assessments, and sometimes caseworkers work with the mother to facilitate treatment, drug testing, or other monitoring. Medical societies agree that babies do best when they can safely stay with their mother, which is why support services and plans of safe care are so important. Outcomes for infants who have been exposed to substances varies by the substance. As a physician, I first consider the short-term impact and then the long-term impact. We know babies exposed to opiates can undergo withdrawal after birth that can be severe and life-threatening. Babies exposed to methamphetamines just before delivery are affected by the drug itself, but there isn't as clear of a withdrawal syndrome as there is with opiates. These are the main short-term impacts that we're looking for in the immediate postpartum period. The long-term impact of a substance is really hard to study because there are so many different factors that influence child development. It's difficult to isolate the effect of one substance, and often there is more than one substance used during a pregnancy. Addiction, ADHD, and other disorders also have genetic predisposition, so it's hard to say what effects in a developing child are from the drug exposure versus genetics versus their environment. Heavy or frequent alcohol use in pregnancy is actually the most harmful to children long-term. I worry most about my alcohol-exposed patients. Alcohol impacts or pickles the entire brain. There are decades of research supporting this and even a medical diagnosis called fetal alcohol spectrum disorder. The effects of alcohol use in pregnancy are often devastating, and we don't fully understand whether it's the amount of alcohol consumed or the timing during fetal development that determines the severity of impairment in the child. The long-term impact of opiate and methamphetamine exposure in utero is less clear, and the effect of these drugs on the brain is more localized. Some studies suggest slightly lower scores on tests assessing a child's development and slightly higher rates of ADHD-like behaviors. Specifically, to answer your question, Chairwoman Nettercott, methamphetamine in the first trimester is actually thought to be potentially the most risky time for methamphetamine exposure, especially heavy methamphetamine use during that time. The primary physician of any drug or alcohol-exposed infant should be performing frequent developmental screening with prompt referral to early intervention services if needed. And then as the child enters school age, they may need more specialized learning assessments. I think care of drug-endangered children would most be impacted by improving our state's plan of safe care. We could standardize discharge requirements from our newborn nurseries and improve wraparound services for these moms and babies. It might also help to identify physicians with experience and expertise in the field to champion plans of safe care and be available for consultation by other healthcare and childcare providers. Multidisciplinary meetings with these physicians, DFS, and other community partners would improve communication and create a better safety net. Specific to opiate use in pregnancy, hospitals throughout the state should be using the Eat, Sleep, Console method for screening and treating these babies with opiate exposure. This protocol has been shown to decrease the length of hospital stay, decrease the need to treat babies with morphine, and reduce the number of transfers out of the hospital, which most often means out of state to Salt Lake or Denver. The Eat, Sleep, Console protocol also improves maternal attachment and bonding, which is critical to a baby's health and development. Improved DFS staffing and training and access to treatment for substance use disorder would of course make a big difference as well. Finally, I want to directly address legislation to criminalize mom with substance use disorder. Criminalizing these moms has been shown to not make babies safer, but rather it harms babies. It makes pregnant women with addiction avoid important prenatal care due to fear. Criminalization is not an effective deterrent to substance use. The research backing this up is so strong that every medical society with expertise in maternal child health explicitly recommends against any policy that criminalizes moms for substance use. Most of the pregnancies we are talking about today are unplanned, but often many of them are very much wanted. In my experience, this is a time that can be a huge wake-up call for women struggling with addiction. I've never met a pregnant mom who does not want to do right by her baby. My work in this field has demonstrated just how powerful addiction can be. Every time I've even discussed taking protective custody of an infant, the mother is full of remorse, grief, and shame, and is very willing to enter a plan of safe care if it means keeping her baby. Pregnancy is a time where women are motivated to change, and bringing them into the healthcare system is our best chance at protecting these babies. Prenatal care is so important in Wyoming. We are a very unique state in that we do not have a children's hospital or any pediatric subspecialty care. Every baby that I need to transfer requires a flight out of state. This is cumbersome, dangerous, and costly. We try to keep babies home, but sometimes we can't. Until a specialized transport team arrives from out of state, neonatal ICU level care is being performed by rural hospital staff doing the best they can. Clearly, we want to avoid having pregnant women who have had no prenatal care show up in labor. These are very high-risk deliveries. We do not know if the baby's premature, if it will be able to breathe on its own, or if it has a medical issue like a heart, stomach, or spine defect. We know that criminalizing these pregnant women will not stop them from using drugs, but it will stop them from going to the doctor because they will be afraid of going to jail or being fined. We need our clinics and hospitals to be safe places for these women so that their babies have their best chance at a healthy start. Any legislation that deters women from getting prenatal care will hurt babies the most. Any questions?
Ms. Bush, I haven't tracked this, but in labor and health, are they drafting legislation on this at all at this point, on anything in this topic area, or are they just receiving data at this point?
Mr. Chairman, I believe that they did not move forward with any sort of legislation, but I could be wrong.
Chairman Endicott.
Thank you, Mr. Co-Chair. Thank you for that data and information and in your work here in Wyoming. What I heard you say at the end is that although it won't stop the women from using, right, we want to protect the babies that they're carrying. So how do we do that? How do we do that? Health and Labor Committee, also tasked with this, does not have a bill draft. I'm assuming at their second interim committee meeting that happened earlier last month.
June is when they had.
And so there is an identified perceived concern or identified concern in Wyoming that there is not a good solution, whether that be the criminal justice system or any other service in Wyoming that eliminates, because that's what we're going for here, is the elimination of the ability for addicted mothers, substance abusing mothers to continue to expose their babies to the harmful substances. And so do you have any thoughts about that?
And real quick, I'm sorry. I mean, that's why I asked the question, Sheila, is because I heard some point in your testimony, you gave a list of wraparound services and different ideas. But that's why I'm trying to compartmentalize as well our work in that if those are the solutions, are additional services. I mean, it's disappointing, I guess, that the health committee hasn't put anything together yet, but maybe they already had their second meeting?
Yeah.
Yeah, okay. Sorry, doctor, go ahead.
That's okay. I honestly think you guys have it right. I think I don't think there's one simple solution for what is a very complicated societal problem. I think I can speak to what I know, which is that every time I get a phone call that there's a mom coming in labor with no prenatal care, my heart rate goes sky high. And my husband, who's a family doctor who also takes calls, says, you better go to this delivery. This one could be bad. And so I guess from the seat that I'm sitting in, the thing that I know that will make the baby safer is for the mom to get into prenatal care. It's not necessarily going to end up in full abstinence with no relapse. But when I talk to moms who have become sober after addiction, pregnancy is often the thing that they say jump-started that process for them. And so in the work that I do, I guess what I sort of cling to, and the reason that I went into pediatrics, is because it's this really unique time in a woman's life where they really get to assess what they're bringing to their child. And so what I know about medical advocacy is that barriers to healthcare make outcomes worse. I just worry that anything that makes a woman afraid to go to get prenatal care is not going to have the intended consequence of keeping babies safe. I think we will have more deliveries where women haven't gotten prenatal care. It's not an answer to what the solution is, because I think, wraparound services are a piece of it, better mental health. I mean, I think there's a mental health crisis in our country beyond substance use. The mental health crisis in teens right now is something that's really being highlighted. And so I don't know that there's like one simple answer for all of it, but I do, as a person who's taking care of babies in our state, really worry about high-risk deliveries and trying to minimize the occurrence of those.
Doctor, what, in your experience, what percentage of moms would seek treatment voluntarily? Because part of the criminal justice system, at least in my mind, the biggest part of it is certainly not to punish these moms, but in a lot of cases, you need a criminal charge in order to get the mom to the services, the treatment that she needs. So just speak to that voluntarily versus because you said something that's very important, which is we don't want to deter mothers from seeking help.
So I think some women start to voluntarily access services when they learn that they're pregnant, even if that's just stopping using on their own and going to the doctor. They might not want to enroll in formal substance use treatments, and for some women, that seems to work. In the discussions that I have with women who are known to have used substances during their pregnancy, when they give birth to their babies, all of them want to do better. And so you will miss out on some of the prenatal care aspect of that. But in terms of moving forward, it is a time where women are really eager to get whatever help they can to keep their babies and often their other children. And so I think having those plans sort of ready to go and standardized, and having like when that mom is ready, because we also know that with addiction, anecdotally, people say that until they're really ready and they've hit rock bottom, they're not going to actually be ready to make change. Most of the women that I encounter when they're about to have their baby taken for them, that's a rock bottom moment. And it's not ideal because you have had exposure to substances prior to that, but it does sometimes turn around what the mother-child attachment bond can be, and we know that that is an incredibly protective factor that can actually overcome a lot of the detriment from prenatal exposure to substances. We don't fully understand why, but it seems to work well.
Vice Chairman Washit.
Thank you, Mr. Chairman. Doctor, I think I heard you testify that your hospital policy is if you have a known fetal exposure case, you do notify DFS. Do you personally support that policy, and do you have good outcomes by doing so?
Thank you. Yes, I actually was one of the people that tried to get that policy more standardized, because I think everybody sort of alluded to the large amount of variability in practice between different providers, and that's a nationwide thing. I do support it because I feel like the more services, the more data. I mean, a lot of what we're hearing is that it's really hard to capture the data. So for me, the more transparency in this process and the less punitive, the bigger chance there is that we can make a difference as a team. Like, it's not going to be one healthcare provider, one DFS worker. It's going to be different for every mom, because what every mom needs is a little bit different. So I have found that to be helpful, because I can say to moms, look, this is what we do when you test positive for a substance. And to be clear, we don't actually report marijuana use because it's so prevalent. I think it would overwhelm services, and it's legal in so many states that it's kind of it's a hard one to really get a policy on. But for methamphetamine and any opiate that's not prescribed, we tell families, this is our protocol. We want DFS to come in and help with services and see if there's any other support that we can provide. And so to me, it makes the conversation a bit more straightforward with families, so that they're not feeling targeted. Like, well, why did her urine screen come back positive and nobody told DFS about that one? So it sort of standardizes the process. The other thing I think that's really important to note is that no screening test is perfect. And so the urine drug screen that's routinely used in sort of the immediate point of care setting actually has some issues with reliability. And so protocol should be that those positive samples are sent to a more like a bigger lab, like LabCorp, to get chromatography and mass spectrometry to really confirm, because there are false positives, and one of the worst things you could do is falsely accuse a mom of substance use. So I think when we've talked about sort of universal screening and some of those things, like most hospitals aren't doing that confirmatory testing. And so I think there's always going to be room for a nuance in that conversation. But if you at least start by then having that open conversation, a lot of moms will admit to what they've used. And there are some known sort of cross reactions with those tests. So it also opens the door to say, hey, you tested positive. This is our protocol. Can you talk to me about like substances that you might have been using during your pregnancy? It's a little bit more of a disarming approach.
Committee, just a brief reminder that we're over an hour behind. So with your questioning, let's try to move the topic forward so we can get somewhere that we can take action or not action on it, unless you want to be here all night. Representative Oakley.
Thank you, Mr. Chair. I am interested, and I feel like I should know better, but how many, do you have a number of how many deliveries are, like, I don't know, per year, I just have no idea how many babies are being delivered at IHS. So if you know that, and then a part of that, so and what's the prevalence or of substance exposed births? And then the next, so we can just save time. And then I'm interested in, then you also mentioned then getting court orders and working with DFS. So you're working with the two tribal DFS. And basically how effective, if you could give us some idea kind of on the ground is what I'm looking for. Thank you.
Yeah, absolutely. I also take call for Sage West outside of the IHS system, so I have a little bit of experience outside of that too, which I think is helpful. And then I would be working with just the county DFS. For IHS deliveries a year, I think the numbers right now are in the 50s. Honestly, the pandemic really changed things, and I don't know why, but there's been a lot less babies born. I think the hospital's delivery around the time that I got there was somewhere around 200 a year. So it's pretty low volume. In terms of percentage of methamphetamine specifically exposed, I don't have the actual percent. Since I started, anecdotally, I feel that there has been an increase in that, but I don't have specific numbers to that. And then my experience working with DFS, it's a more complicated question for a lot of reasons. Wyoming's really unique in that physicians are the ones taking protective custody, and that's a role that a lot of physicians don't really feel comfortable doing because they don't feel like they have the full social picture. And so I think my helpful times with DFS are when they come in and really give me a full social assessment and have done a home visit. And then sometimes they will actually recommend whether they think it's a safe discharge home. For me, that's really helpful because I don't go into the family's homes. Like, I don't know if when the mom tells me that things are great, they're really great, and then you go home and actually there's like needles all over the floor. Like, I don't know that, but you really get a lot of that information from a home assessment. The DFS staffing turnover has been really high since I've been there for 2.5, almost 3 years. And so one of the frustrations I've had is that I'll get a good rapport going with a DFS worker and start to really feel like I can sort of ally with them and develop the plan of safe care, and then there'll be turnover. So it hasn't been perfect. I've also started to work more with like the tribal court system, which I'm on a meeting every week with as well. And I think where I've found that I've had the most success is when everybody gets in the same room and can really talk through a case and figure out like what services would make the most impact. So to me, it's felt like when I've had multiple players involved, it's felt most effective. But it has not been perfect, and there's a lot of, it's not a perfect system. I hope that answered your question.
Go ahead, Representative Oakley. I've got.
Thank you, Mr. Chair. And so I guess just finally, through your testimony, you know, as Chairman Nethercott pointed out, I mean, you said it's nothing, I think was, but will not stop them from using drugs. But so you just want them to get prenatal care. But I guess what I'm taking from that is you wouldn't support a measure that would then compel them to do it. I mean, is that basically?
If it was effective, I would support it. I think there's been a lot of studies looking at that kind of legislation, and it hasn't shown that women stop using. It's shown that they are more afraid to go to care. So I think I am definitely in favor of women not using during their pregnancy. It seems complicated as to what the right avenue is to get to that result.
Thank you.
Senator Cost.
Thank you, Mr. Chairman. I'll try to make this quick. 2 questions for you. Number one, do midwives enter into the number of deliveries and all that you don't have awareness of as far as being able to determine substance abuse? And then the second is, can you tell me, even though alcohol is not classified as a drug, I get that, how much more predominant is fetal alcohol syndrome than the substance abuse syndrome? And does the substance abuse carry over as long as the fetal alcohol does?
Thank you. Good questions. So right now there's no out-of-hospital midwives in Fremont County. So there used to be some home deliveries, but they're a very small percentage. And to my knowledge, those midwives aren't practicing anymore right now. So all of the midwives that deliver are actually doing it within the Sage West Hospital. So I think that they kind of capture the same patient population. As for your second question, the research on this is sort of all over the place. It's interesting. While I worry socially about babies with illicit drug exposure like methamphetamine and heroin, right? Like that's a marker for social chaos and neglect and abuse risk. In terms of the actual effect to a developing fetus, alcohol has much more clear detriment. And alcohol is so widely acceptable in our society that it's really hard to capture the full spectrum of how women are using alcohol during their pregnancy. I mean, there's certainly a large percentage who do not use at all. And then there's also been a recent social movement to like allow some social drinking in pregnancy. And there was a study out of New Zealand a couple of years ago that looked at potentially much higher rates of sort of mild fetal alcohol spectrum disorder than was once appreciated. And so I think because it's so pervasive, it's really hard to know. You know, maybe we would all have like 10 higher IQ points if our moms didn't drink. I don't know. But I don't really know the answer. But it is something that I worry very much when I know there is heavy drinking in the pregnancy. I really worry about those kids long term.
Representative Provenza.
Thank you, Mr. Chairman. Dr. Mook, have you seen any issues with maybe women who are struggling with substance abuse wanting to try and do home births or have other labor scenarios that make it more complicated for you to do your job. I imagine, in addition to that, the difference between like fetal exposed versus like fetal withdrawal and what that looks like coming in. So can you speak to some of that?
Good question. There have been a couple of instances since I've been at this job where women have like not wanted to go to the hospital at all because of substance use. And those babies often are hospitalized for a bit longer once they're, found and brought in. In general, I think women who are using are afraid of the healthcare system. People are afraid of like being judged, receiving, lesser care, or people are mean to them, frankly. And so I think that there already is a bit of a deterrent for those women to access healthcare. I haven't really seen like that population really wanting a home birth in the way that I think there's like a movement to not have babies in the hospital. A lot of them seem to be more accidental with rapid labor.
I really have to get to Senator Kolb.
Okay.
Thank you, Mr. Chairman. The other K down at the end of the table. I hadn't heard anything yet, Doctor, good afternoon, about fentanyl use and how it affects the unborn. Could you share any information about that? Thank you.
Sure, good question. That's definitely a hot topic. So fentanyl is an opioid, like many of the opioids that are being used illicitly right now. It is way, way, way more potent than the traditional oxycodone and other things that are on the street or in doctors' offices. I think that the use of it illicitly has grown so rapidly, so quickly, that I don't think we really know what the impacts of that are long-term. In general, I worry most about opiate exposed babies, which would include fentanyl, in the first part of their life when they have the potential to withdraw. Opiate withdrawal is very, very dangerous. And I would imagine that if somebody was consistently using fentanyl, which is so potent that withdrawal could potentially be more severe, but I don't know that for sure. Opiate exposure long-term has sort of varied results developmentally that are really hard to tease apart. So I would worry most in the immediate postpartum period.
Co-Chairman Nethercutt.
Thank you. Doctor, in your experience, when you have a pregnant mother who is using narcotics come in, or in a rapid birth based on an emergency, is it because they're just not thinking about prenatal care, or is it out of fear, or a combination of all of that as to why they hadn't seen a doctor before seeing you for the first time giving birth?
Thank you. I think most of the time it's probably a mix, but I think a lot of women who are deep into substance use are not thinking about much other than their substance use. My understanding of addiction is that it is like the overpowering feeling where nothing else matters. And so I think the amount of social chaos that women are living in doesn't really fit into like scheduling a prenatal visit and getting there. For some of the women that I work with who have more like intermittent use during their pregnancy, I think a lot of them are really afraid of coming to the doctor and being judged.
And Mr. Co-Chair, follow-up. And so being judged is kind of being treated poorly by those around them because they know that they're using drugs while pregnant. It's just kind of that judgment that they want to avoid. Is there any fear of criminal justice system coming in?
I don't know for sure, but I have read some studies about the impact of having a DFS referral, and that is a really scary experience for women. And so I think there are a lot of women who I think are afraid of having their babies taken from them, and that interfacing with the healthcare system, while of course it is inevitable if you're going to have a baby, I think there probably is some avoidance related to that as well.
And then one last follow-up, which is where I'm driving at. is for consideration is some type of safe harbor provision that if they do seek prenatal care while using that, the consequences associated with that are limited. Do you think that that would encourage addicts to come in or mothers who are using?
I think if word got out that there wouldn't be a penalty for coming to the doctor, and that I think about this a lot actually in my job, is like, how do we message to this women that our clinic is a safe place and that we want to help and make their baby as safe as possible? And I think that that kind of messaging could potentially go a long way if it was like really explicitly shared and became community knowledge.
All right. Thank you, Doctor. Thank you, Ms. Bush. Ms. Semino.
Mr. Chairman, members of the committee, I will be the briefest I can. I just wanted to update you on some updates from Labor and Health that may have been overlooked. At their August meeting, the Labor and Health Committee did decide, because of this issue, to draft legislation that would allow postpartum moms to have Medicaid up to 12 months. And the reason for that is so that they can engage in these wraparound services that were discussed today. As of right now, all postpartum moms have Medicaid up to 60 days. As we've seen from the research, many times those physical, emotional, and mental complications from delivering a child happen right around that 42-day mark. So we are excited to see this bill come through. We're excited to see the possibilities as far as continuity of care. The other point I would like to bring to the committee is that when we are discussing mental health reform over the last few years, at-risk children and their families are part of that priority population. So they will be prioritized within the mental health reform that is moving forward. And with that, I stand for question.
Thank you, Ms. Semino.
Mr. Chairman, members of the committee, Josh Hannes with the Wyoming Hospital Association. I just wanted to share just a couple items very briefly. One is you heard about the plans of safe care from Director Schmidt. We're engaged in that. Our hospitals are supportive of the plans of safe care model. I sit on their steering committee. Labor and delivery nurses in our facilities participate in that as well. And we're fully on board to continue with that. Another thing that's going on in hospitals that I shared with the Labor Health Committee is this learning collaborative called Chosen. So it's the Colorado Hospital Substance Exposed Newborns Collaborative. And so at last count, we have 6 hospitals in Wyoming participating in that. That's a public-private partnership that started in the Colorado AG's office, includes philanthropy. They also use some money from their Medicaid upper payment limit programs. I won't bore you with those details, but that's how they organized it. So it provides some technical assistance, best practices, helping to implement those best practices in your facility. And then the last thing I wanted to bring up, Co-Chairwoman Nethercott's suggestion of a safe harbor. It might be worth looking at New Mexico's statute. And I don't know that I'm as familiar with the details as I should be, but it might be worth looking at. My understanding of what they do is women who are pregnant using substances are protected from prosecution, and then they're required to participate in these plans of safe care. And so they're caretakers, hospitals. I think they really get to select the community of people that are involved, but that might be something to look at if you're interested in other alternatives. And I would stand for questions.
Committee? All right, thanks, Josh. Additional public comment? Online?
Thank you, Chairman Olson. Laura Schmidt-Pizzato from Southwest Counseling in Sweetwater County. Since the year 2000, Southwest Counseling Service, my employer, has, we started the first program that allows pregnant women and women with their children to come into residential treatment for substance use. We have 9 funded beds for pregnant women and women with their children currently. And some of these mothers are court-ordered, some of them are voluntary. It doesn't make any difference. Our outcomes for either one of those outcomes are going to be about the same. But to date, we've had 127 drug-free births during that time for women who are addicted to substances. I think one of the points is that we all want the same outcome here. We all want to have babies born who are safe and not addicted, and moms who are going to take care of those children. And I think that this bill is kind of going the opposite of what it's intending to do. The consequences will be the opposite. So there's a very large study by Vanderbilt Center for Child Health Policy, and they studied 4.6 million births. And what they found was that the states that have the most restrictive, punitive policies for mothers during their pregnancies, those states actually will have more infants born with drug withdrawal symptoms than states that don't have those same policies. So punishment of these moms leads to decreased prenatal care, like your doctor was just talking about, and then just access to treatment to stop the substance use. Many of these moms won't voluntarily go into substance use treatment programs because they are afraid to do that. Just last week, I had a grandparent who called me asking for admission for their granddaughter and for a great-grandchild to be born. And they were very afraid that if they went through the through the criminal justice system, what would happen to this child and other children in that family. And so that mother will be coming into our program later this month. I think there's 2 points that need to be made. We need to have additional awareness of treatment opportunities that are already available within our state, both residential programs and outpatient programs. And then we need to increase our beds available to these women. I mean, we only have 9 of these beds in Sweetwater County. These are state-funded beds. They go to people all across the state. We only have 9. I consistently overflow those beds and put pregnant women into our regular beds that are just designated for women because we do not have enough beds. So thank you. I'll stand for any questions.
Questions, committee, for Ms. Schmidt? All right, thank you for joining us. Representative Sweeney.
Thank you, Mr. Chairman. In committee, while I understand the intent, and I think it's a good intent with this bill, and heard the arguments for and against, one of the most concerning things to me in the bill, page 2, line 1 in the new language is C, no person, comma, while pregnant, comma. So hearing discussions and testimony during this past session, my understanding is with most people, that's at conception. So I'm not an attorney, don't profess to be one, but to me, that's opening that language while pregnant can be interpreted in a number of different ways. And is that really the intent on giving these potential mothers help in a meaningful way and direction? So I'd first look at the intent of while pregnant, what the definition of while pregnant to this bill is in general. And that's my testimony. So thank you, Mr. Chairman, committee.
Thank you, Representative. Yeah, please, come on up.
Oh, there. I too will keep my comments very brief. I'm Holly Thompson. I am a member of the Pro-Choice Wyoming Board of Directors, and I'm also a member of the Community Advisory Committee for the Wellspring Health Clinic here in Casper. I'd just like to add real quickly that I'm also a former English teacher, and I thought you'd like to know that there are a couple of things on here you may want to change. And somebody's going, oh God, get her out of here, I know. It's just on page 4. You just turn to page 4. Line 9, you'll notice at the end of line 9, it says him. And if you'll go down to line 16, there he is again. And I think this is about women, so you may want to make that change too, okay? First of all, from everything we've heard here today, I think the question you have to answer for yourself as a legislature and for your constituents is, are you going to have public health strategies that help, or are you going to have public health strategies that criminalize women? And as you heard today, especially from Dr. Wood, research shows that criminalizing pregnant women for drug use is ineffective and harmful because, and as the March of Dimes puts it, it will drive women away from getting prenatal care. And that's what the research says, and I can cite my research sources too. They're too afraid to go and get that prenatal care. And also, there's always that concern about foster care. Okay, something happening to their baby being taken away from them. It also shows that the policies are often discriminatory against poor women and women of color. And also, women who have been put in jail. That would never happen in Wyoming, I'm sure, right? And they go through immediate withdrawal with a fetus in their body. And they are asked to withdraw cold turkey. That is very unhealthy and very unsafe for both of them. So I would also like to just point out that in the past few years, similar bills such as this have come to the legislature, and none of them have passed. 1996, 1999, 2002, 2006, 2007, 2017, 2020, and 2022. They failed to pass into law. I heard some really exciting things going on as far as treatment and possibilities for the women who's abused substances in this state, and I think that's something that is worthy of study. And I would encourage all of you to choose compassion and healthy strategies over oppression. Thank you very much.
Committee.
Mr. Chairman.
Oh,
we
well,
do
I was just
have-
making sure we didn't have any questions. Okay, Travis, you can join us.
Thank you, Mr. Chairman. I will be brief. My name is Travis McNevin on behalf of the Northern Arapahoe Business Council. As we have testified in the past on this and similar related bills, the Northern Arapahoe tribe is opposed for the reasons that have been outlined as far as being a barrier to prenatal health, and then the challenges associated with potential felony as it relates to education and unemployment and housing opportunities down the road when hopefully better decisions are being made. And so thank you for the opportunity to testify today.
Committee? Oh, too late. Oh, no, he just shrunk on my screen. I thought you were gone. Thanks, Travis. Additional public comment? All right.
Mr. Chairman, we have Lauren Renowski.
How many more people do you have with their hand raised?
Looks like she is the last one.
Oh, okay.
Hello, everyone, and Chairwoman Nethercott and Co-Chairman Olson. I understand that we're running a little behind, but I do welcome questions as that is helpful to the committee. Thank you for the opportunity to submit this testimony to the Joint Judiciary Committee of the Wyoming State Legislature. National Advocates for Pregnant Women respectfully submits this oral testimony in opposition to 23 LSO 114. We are a nonpartisan advocacy organization dedicated to the health and welfare of pregnant people and their families. Our testimony draws on over 20 years of experience studying state responses to such issues as pregnancy and drug use. While this draft bill, if passed, would raise a host of constitutional issues and would undoubtedly be subjected to numerous legal challenges, our most important objection is based on the fact that responding to the health issue of pregnancy and drug use through new criminal legislation will be bad for babies. 23 LSO 114 would create a new crime of felony child endangerment in Wyoming, specifically authorizing the arrest and prosecution of a person who, while pregnant, knowingly consumes methamphetamine or a controlled substance classified as a narcotic drug. Every leading medical group to address this issue opposes laws that create criminal penalties for being pregnant and using a controlled substance, including the American Academy of Pediatrics, stating the AAP reaffirms its position that punitive measures taken towards the pregnant woman are not in the best interest of the health of the mother-infant dyad. In fact, punitive responses to pregnancy and drug use not only lack any proven benefits for infant health, but they in fact harm maternal, infant, and neonatal health by driving a wedge between patients and their physicians, discouraging prenatal care, a point that I believe we've discussed a few times already. The negative impacts on fetal and infant health show that laws such as this actively run counter to the state's interest in protecting infant and fetal health. For example, one qualitative study with mothers who engaged in cocaine use found several barriers to both substance and prenatal care treatment, such as stigma and fear of involvement with criminal and civil authorities and separation from their family members. In most of the cases in which a pregnant person is criminalized, their personal health information, or PHI, was provided directly to law enforcement, a practice not required by HIPAA. But laws such as this rely on this medical provider and law enforcement collaboration. It is almost always the case that HIPAA prohibits disclosures to law enforcement without the presence of a court-ordered warrant, subpoena, or other legal process. However, even if the required legal documents are available for the sharing of information to settle HIPAA, such practices are unconstitutional, as found in the case of Ferguson versus City of Charleston. Let's look at Tennessee, the only state to pass a similar law creating unique crime to address pregnancy and drug use. It was in effect from 2014 to 2016 when it was allowed to sunset because it was proven to cause significant harm to families. Since then, empirical evidence has found that the law not only deterred pregnant people from accessing prenatal and appropriate drug treatment, but also resulted in an increase in fetal and infant health. In 2015 alone, the year after the law went into effect, the law resulted in 20 more fetal deaths and 60 more infant deaths than would have otherwise occurred. Before I close, this draft contains a diversion for first offenders based on the ASAM placement evaluation, followed by appropriate treatment. However, ASAM has consistently opposed the use of criminal law to respond to the issue of pregnancy and drug use, stating state and local governments should avoid any measures of alcohol or other drug use during pregnancy as child use or maltreatment, and should avoid prosecution, jail, and other punitive measures as a substitute for providing healthcare services, with no exceptions made for multiple offenders. Further, the Tennessee law was passed under the similar assumption that it would somehow facilitate pregnant people into care, and instead they were subjected to incarceration, bail they could not post, fines they could not pay, probation conditions they could not meet, and the ever-present threat of more punishment. The argument is clear: even the best attempts to divert jail time by treating first-time offenders is not enough, and at worst, it is only contributing to harm and stigma. This bill will set Wyoming apart as the only state in the country to have a unique crime that criminalizes pregnancy and drug use. Experience from other states that have used existing laws and/or created new laws to criminalize pregnancy and drug use shows clearly that maternal, fetal, and infant health outcomes will only get worse, women will avoid necessary care, and families will suffer the devastating consequences of family separation. Thank you so much for your time, and again, I open it up for questions.
Committee, questions, Representative Provenza?
Thank you, Mr. Chairman. I just had a quick question. If you could repeat the numbers, because I don't know if I heard them correctly. You were talking about Tennessee repealing their statutes that were similar to this. And I think you said that there were, in 2015, 20 more fetal deaths. And was it 60 more infant deaths in 2015?
Yeah, that is correct, Representative.
Follow up. Thank you, Mr. Chairman. And I guess in trying to conceptualize that, because I know Tennessee has far greater population, I think, than Wyoming does. Almost everybody has far greater population. So is that 20 more fetal deaths? I mean, it's still 20 more fetal deaths and 60 more infant deaths. Was that seen as statistically significant, or in other words, was it a large jump in those number of deaths in 2015? And was that cited in the discussion from Tennessee lawmakers when they allowed this bill to sunset?
Those are great questions. And unfortunately, I don't know what the aggregation of those numbers are in contrast to the population size and with respect to differing sizes across the states, but I can certainly get back to you on that follow-up and also provide resources on that exact bill.
Great, that'd be great, Ms. Renoski. Appreciate your testimony, and yeah, feel free to email the committee that follow-up information when you have it. We'd appreciate it.
Great, thank you.
Okay, thank you. Additional public comment? Closing public comment. Committee. Going once. Going twice. Okay. You get to push your little green button there, Representative. It's all right. We're waking up.
Thank you, Mr. Chairman. Move the bill.
Okay. It's been moved by Representative Rodriguez-Williams, seconded by Representative Oakley. Okay. Amendments or discussion on this bill? Representative Yin.
Mr. Chairman, I've heard from a couple of the colleagues on this panel that suggested, if this isn't the way, what is the way? And I think the plans of safe care is actually a good thing that we could focus on either as a judiciary or assign it towards the Labor and Health Committee. The idea that there is a plan to move forward, and that plan also indicates that, if it isn't being followed, that means that the child possibly isn't in, the child is possibly in a risk of imminent lack of safety or danger, which creates that risk for the mother that child could be taken away. And I think that is a much better driver than the idea of possibly putting a woman in jail or on probation. And then we heard from the Department of Corrections that 70% of their probation revocations is actually people from substance abuse. So my worry is that even the idea of just initiating probation still puts a lot of these moms at risk of being in jail. And then you have that long-term risk for the child where they essentially get separated from their mother, which I think we all understand has long-term concerns for the child growing up as well. So I think we have a focus that we can focus on. I'm not sure if this bill is the correct way to do it, though.
We ready to vote? Okay. All right. We'll roll call vote on, what is this, 22 LSO? You know, you'll read it. Go ahead.
Mr. Chairman, this is a roll call vote to sponsor 23 LSO 0114, child endangering - controlled substance use while pregnant. Senator Cooper.
No.
Senator French excused. Senator Kolb.
Aye.
Senator Cost.
No.
Representative Craigo.
Aye.
Representative Larson.
Aye.
Representative Oakley.
Aye.
Representative Provenza.
No.
Representative Washit.
Aye.
Representative Rodriguez Williams.
Aye.
Representative Yin.
No. No.
Representative Zwanitzer.
No.
Co-Chairman Nethercott.
Excused.
Chairman Olson.
Aye.
Mr. Chairman, that does not pass, but not receiving a majority of the Senate
Correct.
members.
Okay. All right. Committee, would you like a brief break or you want to keep going? You just tell me. I need a, okay. All right, let's take a this is a real 5-minute break. 5 minutes.
Was
Doing something else there.
I think the bill, I don't think the bill is passed as a tree.
What was that number?
I don't mind if you can do that, it's two to bill. So it gets voluntary treatment.
Because there's an excused vote.
But that's a treatment.
Okay, so they're.
I don't think we can get it through.
Oh, you said it?
Either way.
No, we'll go.
Yeah.
I'd agree, it won't make a difference. That'd be a funny shard up there.
Oh, no.
I think the safe harbor thing sounds like a plausible way of doing it.
Oh, no.
But I like the bill because I think, I mean, look how much testimony we've heard that. Yes, drug court. But I didn't. Fix the bill before we're bringing it.
You're right. I mean, I don't disagree with what you were saying. I just, Jared just moved ahead before I can make a motion to amend it. But that's the way to go.
Part of it.
We don't get them into trouble. That's the
I wasn't playing. Can I zoom tomorrow? I just got it. We got it. Okay. Yes. I can do it tomorrow. I just So if you guys don't mind, I can do it. I saw
It's not about criminalizing it, because that's not what we want to do. I just got a text. It's not gonna happen. It's dead. Because Tara's not wanting to do it. That's why she was miraculous.
One is still quorum. They could do it.
I don't think it's a quorum of those present. We have to.
Yeah, I don't think it's majority.
But there's four here, so they.
Oh, yeah, Tara came up and
That's still only 50%.
Yeah. Yes.
So.
But it would force Tara.
But she could say yes and still be. It's still.
If Cooper, that's they need a reconsideration on the sentence.
Costco is no.
Yeah.
So it's 2-2 no matter what. Even if Tara votes yes.
No. So they need to get one of them to reconsider. So they just,
They're not. Yeah, it's done.
Maybe.
That's probably true.
And that's what they're
Just, that's what we've been doing forever. It doesn't work. I will ask my DFAs. I know they've been doing whatever they can. That's not true. No, that's not how it works. DFS, I can tell you how it works in our DFS calls the cops and says, hey, we got to take custody. The cop says, okay. They're not going to tell DFS no. DFS takes the call. They might say they're not, but they stop.
All right, and we are back. Ms. Butler, we're gonna do a slight rearrangement of the agenda just to help expedite some things. So bear with me for a few. We're actually committee. I'm gonna bump Office of the Guardian ad litem, which is our 4 o'clock forward. And we'll bring you up in just a second. Mr. Fuller, we have a bill draft 23 LSO 89 Office of Guardian ad litem.
Yep. And Mr. Chairman, members of the committee, this is also 10-01 on the online meeting materials.
The committee in May heard testimony from the Office of Guardian Ad Litem about the need for statutory changes to clarify in certain places a reference to a Guardian Ad Litem program to instead reference the office. The committee moved for a bill draft that would make those changes. That is what's before you right now. I would note most of these changes, and these were the statutes recommended by the office, most of these changes concern the financial aspects of the office and make changes to those references. The staff comment that begins on page 1 just notes that not all of the references to program have been amended in this bill draft, and the committee may wish to consider, and the comment on pages, the statutes I cite on pages 2 and 3 note other places where there are still references to the program. So for example, the court shall appoint the program to provide services when appointing a guardian ad litem. Those are not currently amended in the draft. The changes in the draft begin on page 4 and amend various provisions of the Child Protection Act and the Juvenile Justice Act. And all of the changes just simply, with a couple of exceptions, strike program and insert reference to the office. The one change I would note is on page 5, line 22. And there's another place in the bill draft that does this as well. But it was a little confusing to say unless the county, so for example, reasonable compensation for services, I'm reading on page 5, line 19, and cost of a guardian ad litem appointed by the court unless the county participates in the guardian ad litem program. It seemed a bit odd to say unless the county participates in the office. So that reference I changed to just say the county participates in the program administered by the office. That change is similar to what's on page 6, line 15. Otherwise, the remainder of the changes are, and also page 8, line 15, the other changes are simply just striking program and inserting office. With that, Mr. Chairman, I'd stand for questions.
Committee questions on the bill? All right. Is that another Coca-Cola? Director, please come on up.
Thank you for the adjustment in your schedule. I know it's a time-consuming venture to hear everyone, and I appreciate your accommodation. Again, our bill is, before you is pretty short and sweet that you can get on to other business. Again, as Mr. Fuller said, it's really just changing some language in the statute, cleaning that up from when the Office of Guardian ad litem moved out in 2020 and became its own independent agency from the Office of the State Public Defender. The bill draft in front of you certainly makes all those changes necessary that we asked for, and I don't see any reason why not to carry this forward as it makes all the changes that we need to see in the statute.
Committee? Wow. Okay.
Anything else, Chairman?
Well, just that you promised me 5 minutes and you're not
I
even
gave you
there
3.
yet. Yeah. Okay. Thank you, Director. Public comment online. I don't have anyone on my list. Public comment in the room? All right. Closing public comment. Committee, what is your pleasure? Oh, all right. Moved by Senator Cost and seconded by Representative Zwanitzer. Questions or amendments on this bill? Question on the bill. Will you please call the roll?
Senator Cooper,
Aye.
Senator French excused, Senator Kolb,
Aye.
Senator Cost,
Aye.
Representative Crago,
Aye.
Representative Larson,
Aye.
Representative Oakley,
Aye.
Representative Provenza,
Aye.
Representative Washut,
Aye.
Representative Rodriguez Williams,
Aye.
Representative Yin,
Aye.
Representative Zwanitzer,
Aye.
Co-Chairman Nethercott, Chairman Olson,
Aye.
that passes.
See Senator Cooper, now we're back to unanimous voting. All right, thank you. Next, judicial updates. Ms. Butler.
Mr. Chairman, Madam Co-Chair, members of the committee, again, my name is Elisa Butler. I'm the State Court Administrator for the Wyoming Judicial Branch. I am going to be as brief as I can possibly be in providing you with some judicial branch updates today. The first thing I would like to point out to you is you have a number of clerks in the room, the clerks of district court. They came en masse today. We're very happy to see them. So I just wanted to let you know. And in particular, I would like to recognize Tina Wood, who is the clerk of district court in Crook County, and she is going to be retiring soon. I think she's had over 25 years of service as the clerk of district court in Crook County. So just wanted to say thank you to her for all of her continued service for the state and for the people of Crook County. We appreciate it. We also have a number of judges in the room. I point them out if they're okay with it. They're back in that corner, hiding. So if you would like to talk to any of them, they are here. So the thing I think that probably most want to hear about is e-filing. We are live in the first district court in e-filing in Wyoming, and that is Albany County. So that court went live at the very tail end of August. And right now you can e-file civil filings in Albany County. We hope to be live with 4 courts on e-filing by the end of the year. That will include both civil and criminal filings. So it is coming along. If there are other questions, we did submit an e-filing report, but I'd be happy to answer any questions about e-filing in Wyoming if you have any. Okay.
We're just super excited to have it up and running.
We're
Well, the next step.
We're very
We'll get
excited
there.
as well.
Yes.
So actually, I'll just tell you the 4 courts that we plan to have live by the end of the year include Albany County, Fremont County, Laramie County, and Natrona County. So that is the goal we're working toward right now, and we are on schedule to do that. We have over the last, I would say, 6 to 9 months, the Board of Judicial Policy and Administration, which is the governing body of the judicial branch for administration, they have taken a hard look at the branch and tried to find ways to become more effective and efficient. And one of the things that they have developed is a task force of the BJPA that is called the Judicial Branch Innovation Task Force, made up of 2 justices. So it's the Chief Justice and Justice Boomgarden, 2 district court judges, Judge Wilking and Judge Condor, 2 circuit court judges, Judge Bartlett and Judge Hibben. And then I serve as a non-voting member, and they're looking at a number of issues in order to make the branch more effective, including things like governance, pro se litigants, mental health issues in the courts. They have met about once a month and since April and have made some really good progress. The National Center for State Courts is helping to facilitate those meetings. And so we will continue on with that project for at least for this year. We will have a final report at the end of the year. And the last thing I just wanted to give you an update on are the new judges in the branch. So we've had a new injection of energy into the judiciary with a number of new judges that have come onto the bench. Based on the legislation that you all passed in 2022, we have 2 new judges. One is now seated in Natrona County. So we have a 4th district court judge in Natrona County, Judge Josh Eames. And the governor just appointed a 4th judge in the 3rd judicial district that will be in Uinta County, and that will be James Castee. We've also had a number of new judges throughout the state, and I would be happy to list them off if you would like me to, but all in all, for this year, for 2022, we've seated 11, or will seat 11 new judges.
And I think Ms. Butler, if I may, just I I think the thing to really point out there is the work of the Judicial Nominating Commission going around the state, and those are essentially volunteers that have had to make that many of appointments, and then comparing that to previous years, it's a huge task. So just from behalf of the committee, definitely really recognize that and appreciate all their work.
Mr. Chairman, thank you. I will be sure to pass that along. And then the last topic is Chancery Court. And so Chancery Court has been up and running since December 1st of 2021. We have had 10 cases filed in that court. That is actually on par with what has happened in other Chancery courts across the nation. When they create a new jurisdiction of court, it takes a while for that court to get up and running. But that court is moving along with the help of Judge Lavery and Judge Sharp, who are acting as the Chancery Court judges, as well as their day jobs of district court judges. So we appreciate their help. And Mr. Chair, that is all I have for you today, unless there are any questions for me.
Okay. Committee? Questions for Ms. Butler? All right, we appreciate the updates.
Thank you.
Next committee, you have a memo from Mr. Fuller on Clerks of District Court constitutional origin. Mr. Fuller, we appreciate your work on it. I'm not going to have you go over it, but committee, it's in your materials, so please review it. Auditing, Department of Audit.
Mr. Chairman, members of the committee, Justin Chavez, Director of the Department of Audit. So just give a brief overview of what our role is in terms of auditing courts, which will be very brief because it isn't much. District court financial information is reported to us with the county information on the census report. So we get that information, we analyze that document in a whole, as a whole. If there happened to be anything with the court numbers that stood out, we might follow up on it. But for district courts, we don't do any auditing because historically, I believe that's been picked up as part of the county CPA audit that's required on an annual basis. So when it comes to the court system, the only auditing we do as a department is when we audit a town that has a municipal court function. We will audit the revenues and expenditures of the municipal court function as part of our audit of the town. Beyond that, we don't do any auditing function of the court system. So with that, I'd take any questions you might have.
Committee? Co-Chairman Nethercott?
Thank you, Mr. Co-Chairman. Do you know how the courts do get audited?
Mr. Chairman, Madam Co-Chair, the district courts, I believe, are audited as part of the annual CPA audit of the county. I believe circuit courts fall under the jurisdiction of the Supreme Court.
Thank you. Additional comments? Nope. Okay, we appreciate it.
Thank you.
We appreciate you clarifying what you do not do. Jeremiah.
Sorry, I'm coordinating a lot of different testimony today. Mr. Chairman, this is actually my second committee today and the second topic of 3. Mr. Chairman, members of the committee.
In the wrong order. This is committee number 1 and you're at committee number 2.
I'll make sure that that's coordinated better next time. Mr. Chairman, members of the committee, I'm Jeremiah Riemann here on behalf of the Wyoming County Commissioners Association. First off, I wanted to state that I'm here to be a resource. I may not have all of the answers that you may have, but I will certainly obtain answers where I lack them. As a starting point, and you just heard from the director, counties adhere to the same financial disclosure as well as auditing procedures as the state and other governmental entities that are covered under Wyoming Statute 91500, and it goes through a number of different provisions there. The county clerk of court comes under the county auditing interest and procedure. So we obviously have a clear interest in that. However, there is an issue to some degree with authority. In particular, as I've looked into this particular issue, there's this question about confidentiality of records that exists. These are state records, and in some instances, counties have been told that they are bound to confidential status, and as such, auditors can't see those. Now, some counties have said that's not the way we're going to work. It's important that we evaluate these records, and we're going to proceed, and our auditors are bound to confidentiality just as any other contractor that we might have. And so that's the instance in all counties, save one instance where we had an issue in Goshen County. Now, things have changed dramatically in Goshen County more recently, and the commissioners there have said, we are moving forward with auditing these records, permanently moving forward, despite the guidance that we received from the state that we may not have that authority to do that. Mr. Chairman, what I would suggest perhaps is a couple of different options for us moving forward. One is that we have a more defined agreement between the counties and the state relative to these records so that there's no question that they are to be audited by the county, and that will occur with confidentiality controls. The second one is perhaps, and that one can be done without, or can be done through administrative process, not through any sort of legislative process. The second option is to make it statutorily clear that these records will be bound to confidentiality and will be audited by the counties and the value of that perhaps is to give some confidence to the counties when they go about auditing those records. Why is that important? Well, if you take the Goshen County example, what happened there when they went to their insurers relative to this is they said, we can't cover you because these are state records, this is state information, you have no authority. So without some sort of definition, then we may be at some odds with even those that we would like to be insured by. So with that, Madam Chairwoman, I'd be happy to take any questions. This is something that commissioners take seriously, are auditing them, but we did have one example where there was a clear issue here in the state.
Mr. Raymond, can you remind the committee what that clear issue was?
Madam Chairwoman, members of the committee, I'm not going to be the best to describe the particular situation, but we did have an embezzlement situation in Goshen County whereby, as I understand it, the clerk of court was maintaining two state accounts. One was an account for collections, a second for operations, and was embezzling from those accounts. What I was advised is that the clerk of court there had indicated to commissioners that it was not appropriate to audit those accounts because they are state accounts against the state's court system for in the most part. And that was backed up by the state saying these records are confidential and should not be evaluated. And so the commissioners took that advice. Unfortunately, it was bad advice. And now they have changed procedures in the county to, one, ensure that an audit is going to happen. And I think the clerk of court's here, so she perhaps can talk about this more clearly than I, but I believe they're also discussing things of separation of duties to ensure that there's additional protections against those accounts. And so there is auditing that is now occurring relative to the clerk of court in that county.
Mr. Riemann, is there training provided to the clerks of court regarding appropriate accounting practices such as separation of duties?
Madam Chairwoman, I think there are a slew of clerks of court here. Perhaps they are better to answer that. I do not know that answer. That said, the state statutes that you even revised this last year do provide clear authority for the Department of Audit to prescribe procedures and for county officials as well as others to adhere to those particular statutes. And in the instance that they're not, I believe it also gives the authority for the department to make recommendations for removal of those officers when that doesn't happen. They cannot remove them themselves, but can make recommendations for removal.
Mr. Riemann, I have a hard time understanding how that works if the Department of Audit doesn't audit them. How would they know whether or not their rules are being followed?
Madam Chairwoman, all of the local audits are submitted to the state as well as our financial records. You heard about the cost of government report. All of that is submitted to the state.
And that just happened recently in light of our legislation, and that's why the Goshen County situation wasn't caught?
No, Madam Chairwoman, that's been in place for some time. The Goshen County example is slightly different relative to the clerk of court in that particular instance. As you heard, there's no additional auditing requirement that the department has to enforce against the counties.
Thank you. Committee. All right. Thank you. Ms. Wood? Or all of the clerks? I mean, just pull those chairs right up with you. Actually, it's probably not a bad idea. Yep, nope, just steal those chairs right from the front row. Just bring them right on up. Just squeeze in. We want all of our clerks. Or a third of them.
Mr. Chairman, would you like us to introduce
That would
ourselves?
be wonderful. Yes, please do.
Okay. I'm Paige Rhodes from Johnson County.
Diane Sanchez, Laramie County.
Tina Wood, Crook County. Mona McCauley, Platte County.
Janet Montgomery, Sublette County.
Renee Botten, Sheridan County.
Korea, Goshen County. Jill Keister, Natrona County.
All right, so a part of the state, I guess not the, what is it, was it Teton County? Didn't hear?
Mr. Chairman, my clerk of district court is doing her job, just like these clerks are doing their job. But sometimes it gets busy.
Representative Ian, that was a really good save. No, I recognize it's a long drive for the western side of the clerks, obviously. Ms. Wood, go ahead.
So in regards to, we would just like to make a statement, and then I guess if you would have any questions of us as far as audit. The clerk of district courts is a part of the executive branch, just like the county attorneys, the county clerks, the county treasurers, the county assessors, the sheriffs, the coroners, as well as the county commissioners. We perform executive duties. We do not interpret law as the judicial branch does and makes the law legislative branch, but we execute and perform those duties as directed by the interpretations and the rulings of the judges and the rules and statutes passed by the legislatures. We are part of the checks and balances system between the branches. In my county, I've seen a justice of the peace turned into a circuit court to administer and roll the misdemeanor offenses and claims, small claims. However, the clerk of district court and the district court offices have continued as a respected and working system addressing high crimes, family law, probate, and juveniles, adoptions, money judgments as other cases in the district court. As we've seen charges against county attorneys, a couple of county treasurers, a sheriff, a clerk of district court, I think a legislative response is appropriate. Perhaps addressing all of the offices in the executive branch would be the most appropriate. We handle money and we should be held at a higher standard of accountability with annual audits and perhaps an increased bond requirement of the offices. As far as the audits, we've discussed here that yes, indeed, we all go through a county audit. It may look different in the different counties, but we all go through an audit. I think there was the unfortunate incident that happened in Goshen County, but that's 1 out of 23. We all felt and feel that we are appropriately audited. I'm not sure when Mr. Raymond is talking about the state, if that's the state audit or if it's the Supreme Court. So I don't know where he's asking about that or talking about that. But as far as the confidentiality of the records, and I'm just going to speak for Crook County, I don't see that there is a confidentiality issue between my auditors and my offices when they come. They may see that it's a juvenile number that so-and-so paid, but he has no clue that that's a juvenile case. And putting 2 and 2 together between the association of a juvenile case. I feel like I'm completely audited. I've had successful, as I think everyone is nodding except maybe one of us here, that we have had feel like we have been appropriately audited. So I don't know if anybody else has anything else to add, but we would stand for questions.
Mr. Co-Chairman, question?
Go ahead.
Thank you, Clerk Wood, and thank you for your years of service in Crook County. So the bill, I think, is before the committee today in light of the concerns we heard in our May meeting that came out of Goshen County and then left, I think, the Goshen County commissioners and Goshen County itself having to find the funds to replace what was stolen. And I think they needed to find over like $100,000 immediately in order to address those outstanding concerns of the missing stolen money. But had there been a higher bond in place that had been updated, that bond might have served to protect the county from that loss. And so that's the genesis of this bill draft. Does the Clerks Association support the bill draft?
Madam Chairman, Chairwoman, we have discussed it, and I believe that we are not going to oppose it if the legislature feels that the bonding amount needs to be $100,000. But then again, we also feel that there are other offices, such as the county treasurer's office, who handles millions of dollars, that can be $10,000 as well, the minimum amount. And when this topic came up, I did a little bit of a survey. I got 17 counties to respond. The county treasurer's bonds go anywhere from $10,000 to $450,000 in one county. The clerks of district courts bonds range from $10,000 to $75,000 in the 17 I got answers from.
And I guess this is where maybe Mr. Riemann might be helpful. Is there any objection from the County Commissioners Association, who's part of the funding mechanism for these bonds, object to this increasing of this amount?
Madam Chairwoman, I've not had a chance to discuss this at length with the county commissioners to determine whether they would oppose moving from $10,000 to $100,000. I think it's important to note, however, that the commissioners, just because it's at 10,000 does not mean that that's where they are setting or obtaining bonds. Many do have bonds in excess of the $10,000. I think it's important perhaps that we consider some flexibility here for the commissioners to make those decisions at the local level. It's a pretty significant increase to $100,000. That does come out of the county pocket when you have to go up to that level, the additional cost of that. So I think it's important for us to have a conversation, and I'll do that with my members and get you a perfected answer, but I'm hesitant to say a tenfold increase is appropriate.
Ask the Goshen County Commissioners. All right, thanks, Mr. Reaman.
Let's, sorry, let's just, for the public record, let's just pause real quick. And Mr. Fuller, why don't you just, it's only a couple pages, but introduce the bill so that everybody knows what's in front of us now that we're talking about it.
Certainly, Mr. Chairman. 23 LSO 92 Working Draft .3 Clerk of District Court bond amount. This bill draft simply increases the bond amount for clerks of district court in 53208 from $10,000 to $100,000. The staff comment on page 2 and going on to page 3 just provides a list of the various county officers and their bond amount requirements. So the county assessor on page 2, line 30, and then going on through page 3 are a list. The one I would note would be the county treasurer. This is page 3, line 17. That states a bond in an amount prescribed by the Board of County Commissioners. And then the last sentence of that, if the board has not prescribed the amount of the bond, it shall be not less than the total amount of taxes levied for the year. With that, Mr. Chairman, I'd stand for questions.
Okay, questions on the bill? Construction? Okay. Additional comments from the clerks? I mean, you already talked about it. Okay, and we know county commissioners, you're gonna circle back and let us know what you think. Even if we advance the bill today at what it is, it doesn't mean that we can't talk about how to fix that in November and get to a place where we're all comfortable with it, right? Okay. Co-chairman? No?
Yeah, Mr. Co-chairman, thank you. I know to Mr. Reaman, to the point, if we can get an estimated cost or to the clerk of courts for the increase in this bond amount coverage, I don't think it's probably as much as we fear, but it is an increase in cost to have that. I sense that these low bond amounts statutorily currently there, no doubt, are as a result of just being antiquated laws and don't reflect actually a practice that's occurring. And so as the legislative body, is it our role to just ignore that, or should we modernize that to be reflective of what's currently happening? And so probably have a greater conversation, and also maybe not, and it's outside of potentially the Judiciary Committee's role, but a review of all of those county offices. And of course, that would create a lot of concern, but that's why it's simply the clerk of the district courts at this point in time, as opposed to the county treasurer or anyone else. So we'll stick with that for now, but it certainly would be appropriate for those other committees or for the County Commissioners Association maybe to take that as a priority to update those amounts for those offices as well, I would think.
Yeah, antiquated. Mr. Fuller, what's the statute say in terms of the last time that $10,000 was? Because I feel like I remember looking at this when we started the bill. And it's, yeah. Do we have public comment online? Public comment in the room? Okay. Well, I suspect it's very antiquated. If I remember right, I feel like this was the turn of the century.
Mr. Chairman?
Do you know, Ms. Wood? Yeah, a different century.
There was a comment earlier, Mr. Chairman, there was a comment earlier about if there was any training for financials for the clerks of district court. We are going to get a much better training as far as the financials when we all move forward with the full court enterprise system. I think there was, as we know and you've heard, that there was different training for all of us when they rolled out the Y-User program. The Supreme Court has done a very good job in making sure that what Albany County learned that when they first went on, that Crook County is going to learn in November, and the 8th Judicial is going to learn in the years, or well, not years, but next year, because they're going live in August, that we will all have the same training to move forward and making sure that something like this isn't going to happen. Because I think there was some practices that were, allowed to be outside the system and allowed for some, obviously, some things to happen.
That's really good news to hear. Thank you. Vice Chairman Washington.
Thank you, Mr. Chairman. It's for Mr. Riemann. You mentioned the insurers needing to know the status of these funds and whether they're being audited properly and so forth. Does this bill draft address that adequately for your needs?
Mr. Riemann.
Mr. Chairman, I appreciate the question, and it goes back to Senator Nethercott's reference to Goshen County. Whatever you set these bond amounts at, I want to make it clear, as I understand the Goshen County situation, they had supplemental insurance in place to protect against these particular sorts of incidents. In that case, their insurer has come back and said, we're not going to cover that because we have this issue over the state saying there's no protection of confidentiality of records. You can't even be reviewing those. And so even though Goshen County had safeguards in place, bonding and insurance, there's this issue. So that's why I'm suggesting that maybe one of the corrections that could exist is to make it very clear, and I was talking to the Department of Audit earlier about this, I guess there's some federal protections that indicate that for some programs to ensure that they can be audited at the state level, just to have some language in there that suggests and makes it very clear that the county can audit these particular issues so that on the back end, the insurance can protect us and a bond, whatever that amount is. So again, I will very much have that conversation with my members about the bond, but in this instance, as I understand it, Goshen County tried to do something right and still ended up in the situation that they were and had to react financially.
Follow up?
Might the commissioners be able to supply us with some suggested language for what that statutory language compelling might look like?
Mr. Chairman, I'd be happy to.
Senator Cooper.
Thank you, Mr. Chairman. Mr. Raymond, maybe you can supply us some information on what the incremental cost for the counties would be for these type of bond increases per $10,000 or whatever the number is, if you could, please.
Be happy to.
All right. Senator Kolb.
Thank you, Mr. Chairman. So the 30 bonds that we're talking about that were tried to be acted upon, apparently, are they worth the paper they're written on? Because they said that you couldn't collect on said bonds because they didn't have the authority to do the audit?
Mr. Chairman, if I can just be clear, I don't know whether they were able to collect on the bond. They had procured supplemental insurance to protect the county, and that's where they could not get, they could not pursue recourse.
Senator Cost, just the only senator that hasn't asked a question here. You good? Oh, okay. All right. All right. Mr. Fuller,
Yep, Mr. Chairman, that law in 183102 traces back to a territorial law in 1876.
That's right.
I'm only able to see amendments to that section from 1998 forward. The only one that is pertinent to this discussion was in 2003, the bond language for the county coroner was amended to what it is. Otherwise, I can't see anything before it. There's been a number of changes throughout the years, but I'd need the session laws to look into that.
Well, there you have it. Okay. Representative Yin?
Mr. Chairman, may I ask a question that has nothing to do with audits to the clerks?
Sure, why not?
Thank you, Mr. Chairman. Clerks, thank you for being here. Apologies. Clerk Sutton was at the Lander meeting when I was not, so she obviously does a better job than I do. So I wanted to bring up the fact that my clerk just had a primary challenge where the number of votes in the entire election was 480. So 480 people decided who was going to be the clerk of district court in my county. And so my question to you all is, does it make sense for that position to be partisan instead of deciding in a general election ballot? Thank you, Mr. Chairman.
Oh, wow. That's a fun question.
Mr. Chairman, Mr. Co-Chairman, in response to that, I think that you could say, ask that question of all of the executive branch offices, whether it's a county attorney, a county treasurer, county assessor, or county coroner. Does the party matter in that? In the local offices, I would say, yes, it does, because those are our communities, and the parties reflect our communities, and that's who elects us for those positions.
Yeah. Representative Rodriguez-Williams.
Thank you, Mr. Chairman. Question for Mr. Ryman. Just curious if, to your knowledge, of any of the counties utilize a business associate agreement with the auditor for protection of confidentiality?
So, Mr. Chairman, Representative Rodriguez-Williams, it's my understanding that all of the agreements that the counties have with auditors have confidentiality provisions. So I don't think on the county side that there's any issue that or concern that we have that those records wouldn't remain confidential. What I was hearing is that the state is suggesting that that could not be shared with those auditors because of their confidentiality concerns.
Co-Chairman.
Thank you. And we'll wrap up with this quickly. The state, meaning the state as applied to the district court records?
Mr. Chairman, Senator Cott, that is my understanding. It's the state court system. So when I say the state, that's what I'm referring to. But
And were there any other district court clerks who were posturing that position other than the one? No.
Mr. Chairman, what I've heard is that there are some other counties where that has been suggested down to the county level, but the county itself has made the determination that the audit is their responsibility and that they can maintain confidentiality, and so they will pursue it. It just happens that we had this one instance where that wasn't the approach that the commissioners took based on advice.
All right. Thank you again, Jeremiah. Thank you again for a second go around. Thank you, clerks. Thank you all for being here. We appreciate it.
Did you ever hear who at the state level said that it was permissible for them to be released? Who made that call?
Any additional public comment? Closing public comment. Committee? What is your pleasure, Vice Chairman Washut?
Mr. Chairman, we've made several requests for some additional information, and I just suggest that we table this until our November meeting, and then we can take action on it in November.
Okay, you don't really have to table it if nobody's going to move it.
Same difference.
Same difference. Okay. All right. Sorry, okay. Next, Mr. Fuller, we have 23 LSO 0194, a bill that this committee should already be familiar with.
Yep, Mr. Chairman, this is draft 0.3, and it is identical to the draft the committee considered last year. So this would be a bill that would authorize, pursuant to rules that the Supreme Court promulgates, authorize the award of housing assistance. So moving to page 2, line 5, this draft just specifies that subject to constitutional and statutory provisions about when salaries can become effective, justices and judges may receive housing assistance if the judge or justice resides in a county in Wyoming where the average cost of housing is significantly higher than the statewide population weighted average cost of housing, and the Supreme Court would be required to promulgate rules to enact this. The staff comment, which is identical to the comment that was included in the version the committee considered last interim, is just whether to consider a minimum set percentage, i.e. the average cost of housing exceeds X percent of that statewide weighted average cost. This act would be effective July 1, 2023. The memo that accompanies this bill draft that was included with the meeting materials is the same as last year's and just includes constitutional provisions concerning salaries and the potential of the receipt of special legislation. With that, Mr. Chairman, I stand for questions.
Thank you, Mr. Fuller. Committee, questions for Mr. Fuller? Is this a question on the construction of the bill? Just for Mr. Fuller on the construction of the bill. Yes. Okay.
Thank you, Mr. Chairman. That's the best guess at it, so you can tell me if I'm wrong. Unsubstantial, what is the LSO's, I guess, investigation into what that word means when it comes to about the mean housing costs? And it was some reference there where it was they used the word substantial in some cases. I just wondered what your opinion was on what makes substantial as a percentage differential.
Mr. Chairman, Senator Kolb, are you referring to some reference in the bill or?
Yeah, on page 2, line 10. Significantly. Oh,
okay.
Sorry. I didn't have it. I was just recalling.
Yep. Mr. Chairman, Senator Kolb, I think that ultimately the interpretation of that term would be up to, I think, the Supreme Court to decide through the rules they promulgate for the award of this housing allowance.
Butler. Have her walk through that this is an adoption of the A&I rule.
Significantly?
Ms. Butler, I think it might be helpful to refresh the committee's recollection on the A&I rule process here, which is, this is just mirroring what we already have for other executive branch employees, right?
Mr. Chairman, Madam Co-Chair, members of the committee, my name is Elisa Butler. I'm the State Court Administrator for the Wyoming Judicial Branch. Just a reminder. So yes, what would happen with this bill is it would give basically rulemaking authority to the Wyoming Supreme Court. Our rules would mirror that of the executive branch. What I can tell you is right now, all state employees who don't have statutory salaries, I believe, receive this housing allowance or are eligible. I should say they are eligible for the housing allowance if they live in areas that have significantly higher housing costs. Right now, that is limited to Teton County. As part of the executive branch policy, they do an annual, I believe, analysis of the housing costs across the state to determine who is eligible for that housing allowance. And what this bill would do is it would allow the judges to be part of that housing allowance eligibility. Right now, because they're paid statutory salaries, they are not entitled to that housing allowance. But I can tell you that other judicial branch employees in Teton County do get that housing allowance currently. So, so this would just allow the judges to receive it as well.
Hopefully that's helpful, Senator Kolb. Committee, I wanted to just explain that Co-Chairman Nethercott and I added this bill back to the agenda because you are familiar with it, and just as a reminder, it was HB 40. On introduction, it had 37 votes. So but for that undemocratic, unholy 2/3 in a budget session, 1 minute to explain a bill and 30 seconds to rebut it with what may have been significant misinformation to the House of Representatives, this would probably already be law. So I think the committee should, I think it's worth having the full discussion on the bill more than a minute and a half on the House floor, and certainly giving the Senate the opportunity to discuss it as well. So that's why the bill is back in front of you. Thank you, Ms. Butler.
Thank you, Mr. Chair.
Yeah, oh, go ahead, Representative Oakley.
Thank you, Mr. Chair. Ms. Butler, I was interested, you said others are receiving, in Teton County are receiving housing?
Mr. Chairman, Representative Oakley, other judicial branch employees who are not judges are currently receiving the housing allowance.
In what position?
The clerks of the circuit court are receiving the housing allowance. So yes, state employees as a part of the state of Wyoming housing allowance policy do receive that.
Mr. Co-Chairman, yeah. So the judicial branch, the court, identified that they are the only state employees, the judges are the only state employees that do not qualify for a housing allowance, period. That is inequitable. And so they are asking for equity to be consistent with all other state employees that actually reside throughout Wyoming. And historically, I think this became a concern for many state employees up in Campbell County when housing there was very high. Currently, right now, it's affected Teton County. But of course, that can change with market conditions, as we know. And so that's the crux of it, and the language mirrors how it applies for the rest of the state employees, with the one exception of the judges of the judicial branch.
And I don't recall all the agencies off the top of my head, but I think it's Game and Fish, and I feel like it was Department of Family Services. Representative Zornitzer, you may recall.
I believe almost any state employee under the rules is
Or
eligible, and teachers.
But I was just thinking of those currently utilizing it in Teton County.
I don't know the exact numbers, but I know there are. Any agency up there, Game and Fish and DFS both come to mind.
Mhm. And but for our branch of government housing all of our employees in Cheyenne, I mean, we're talking about, again, the point that the executive branch has access to this, judicial branch does not. Obviously, we don't need access to it, given that all of our employees are centered in the capital, but otherwise it would be an equal problem for our branch as well, I would say. And Representative Yin, you're not an employee.
Mr. Chairman,
Or are you?
I do get paid by the state of Wyoming,
Yeah.
but I do not get a health housing allowance. But I am also not asking for one.
I'm waiting for my compensation as well.
Yeah. Committee? Oh, Representative Yin?
Yeah, Mr. Chairman, just a reminder for myself, this is one that was sponsored by Judiciary last year.
Correct, yes. This bill was sponsored by the Joint Judiciary, and it failed introduction by 3 votes.
Because why?
Well, yeah, I may have explained that too quickly, but this, as you all know, the bill, you explain a bill in a minute, and I believe the testimony on the floor in the 30-second rebuttal was specifically that we do not need to build housing, state housing, for our employees, which is not what this bill does. And so whether that changes 3 votes or not, I don't know, but I just think it's important to have a proper conversation with the actual facts behind this bill. Yes, Vice Chairman Washington.
Thank you, Mr. Chairman. Do any of our judicial employees in Teton County live outside of Teton County and commute in, like some of our other public employees?
Mr. Chairman, Representative Washit, they do. Some of them do, yes. No. They are not under statutory. They have to reside in the counties or the judicial district where they are judges.
Representatives Wanitzer?
And thanks, Mr. Chairman. And there was an opening in the district court up in Teton County last year. And how many of those people who applied lived in Teton County, and how many people who didn't live in Teton County applied? And is the number, in fact, 6 people, and they all lived within Teton County because nobody else would take the judgeship up there who didn't already live there? Would that be correct?
Mr. Chairman, Representatives Wanitzer, I don't know the answer to that question, and that is mostly because the applicants to the Judicial Nominating Commission are confidential generally. I believe the top 3 names that were sent to the governor, I believe they all resided in Teton County.
Okay. Thank you, Ms. Butler.
Thank you.
Moved by Representative Provenza and seconded by Representatives Wanitzer. Here, this is your chance, Judiciary Committee, for just one more unanimous vote. Just question on the bill?
Roll call.
Roll call on the bill?
Senator Cooper? Aye. Senator French excused. Senator Cole?
Aye.
Senator Cost?
Aye.
Representative Crago?
Aye.
Representative Larson?
No.
Representative Oakley?
No.
Representative Provenza?
Aye.
Representative Washut?
No.
Representative Rodriguez Williams?
No.
Representative Yin?
Aye.
Representative Swanitzer?
Aye.
Co-Chairman Nethercott? Aye. Chairman Olson?
Aye.
Senator Cole, aye, and no.
That passes.
Yeah, Mr. Chairman, I had from the Senate 3 ayes, 1 no, from the House 5 ayes, 4 noes, so that bill does pass.
All right. Not quite unanimous, but really close. Okay. I think that clears this. I'm just double checking. There was a lot under this one. Yep, we're good to go. We are finally to our 2:45 topic, but to give you comfort, we already did our 4 p.m. topic. So this will be our last topic for the day, pedestrian safety. We have, oh, I thought we had 2 bills. Oh, we have a memo and a bill, Mr. Fuller. Who's presenting the bill, Mr. Hopkinson, and then who's presenting the memo? Pierre?
I am presenting the memo.
Okay, is there a preference on does it matter which order you take that in? You tell me what's logical.
Mr. Chairman, perhaps the memo first and then the bill.
Okay. Go ahead, Pierre.
So the memorandum provides an overview of statutes on vehicle homicides in Wyoming, other 10th Circuit states, and other Western states. And this memorandum specifically covers the penalties that offenders may receive after committing vehicle homicides. In 6 states, including Wyoming, the penalty varies in severity, ranging from a misdemeanor to a felony, depending on whether the driver was driving negligently, recklessly, or the driver was driving under the influence. Typically, the penalties are more severe for when the driver is driving under the influence. And in 2 states, Montana and South Dakota, state statutes refer to vehicle homicide when the driver is operating a vehicle intoxicated and not when the driver is driving negligently or recklessly. Oklahoma does the opposite, where the state statutes concerning vehicle homicide only refer to reckless driving and not driving under the influence. And Kansas statutes are similar to Oklahoma's, as Kansas laws refers to vehicle homicides only when the driver is negligently operating a motor vehicle. LSO identified only one state, Nevada, where statutes provide enhanced penalties if vehicular manslaughter occurs in a work or pedestrian zone. Nevada statutes provide that if the offense occurs in a pedestrian or work zone, the offender may be subject to an additional penalty equal to the penalty available for the primary vehicular manslaughter offense, which is up to 6 months in jail and a fine not to exceed $1,000 or both. Utah laws provide that if a person causes the death of another person while operating a motor vehicle in a negligent or criminally negligent manner, and while using a wireless communication device, that person commits a felony. And New Mexico includes a specific provision that should a homicide happen while the driver is resisting or obstructing an officer, that is also a felony. And I will stand for any questions.
All right, excellent job. We appreciate your research into this. Mr. Hopkinson?
Thank you, Mr. Chairman. David Hopkinson with the Legislative Service Office, walking through 23 LSO 113, homicide by vehicle in a crosswalk or school zone. This bill is before the committee. At the last meeting, they requested LSO to draft a bill that would create a new crime for homicide by vehicle when that crime occurs within a crosswalk or school zone, providing for an enhanced offense. What this draft does is it creates a new crime known as homicide by vehicle in a crosswalk or school zone. Walking through the draft, on page 2, it's simply some conforming language additions there to account for the new subsection E that's created, which provides for that new crime. On page 3, subsection C, the new language there is simply adding the new crime, homicide by vehicle in a crosswalk or school zone, to the section that allows the department to revoke or requires them to revoke a license or permit for anyone convicted of that crime. And then the meat of the bill is in the new subsection E, starting at the bottom of page 3 and continuing through page 4. And this provides that a person would be guilty of homicide by vehicle in a crosswalk or school zone if, well, first that they would be punished by up to 10 years in prison and a fine of $10,000 or both. And the elements of this crime would essentially be that if they commit the offense of homicide by vehicle, which is established in subsection A, which basically requires that a person operate a vehicle in a criminally negligent manner and his conduct is the proximate cause of the death of another person. So if they commit that offense and that offense occurs within any crosswalk as defined by statute, and that definition is listed in the staff comment, or within a school zone when a reduced speed limit is in effect, consistent with Wyoming statute, which is listed in that staff comment. So in essence then, if the offense occurs within a crosswalk or when a reduced speed limit is in effect in a school zone, the homicide by vehicle is a 10-year felony, $10,000 fine. And with that, I would stand for any questions.
Questions on the bill? Representative Yin?
Mr. Chairman, thank you. Just to confirm, Mr. Hopkinson, for a person to be found guilty of this crime, they also have to be guilty of homicide by vehicle, which requires operating in a criminally negligent manner. Is that correct?
That's correct.
All right, thank you, Mr. Hopkinson. Department of Transportation.
I don't think he wants to testify under this bill.
You don't want to test, you don't have,
No, he's not testifying on criminal.
Welcome, Director.
Mr. Chairman, members of the committee, thank you. Mr. Chairman, members of the committee, thank you. A pleasure to be here today to talk about this important topic. I think, you know, in the interest of time and working through the material, each one of you has a handout of our presentation, and really what we thought we'd really briefly talk about today with your invite is to review Wyoming statutes, and I'm on page 1 in the agenda, to look at some stats and walk you through what our thought process is in evaluating the need for crosswalks, and then to look at the different type of crosswalks that we actually have in place, and then talk some funding alternatives. I certainly always would start this by acknowledging that safety is our focus on the roads, and that one death is too many. And it's really specifically tough when you lose a pedestrian, specifically in a school zone, but really anywhere on the system. So if you look at, I'll tell you, we just actually had a very close call here in Lander. I was just looking here in Fremont County here about 3 weeks ago. Luckily, the child was not killed. She was actually crossing at a light, and the button had not been pushed. And she crossed, and some traffic saw, you know, the traffic followed the lights, and she was hit and injured, but, you know, thank you, Lord, not killed. So the problem continues across our state. If just point you to slide number 2, it's a quick rendition of all of the current statutes that deal with pedestrians' rights and duties. And I won't walk you through each one of those, except to say that there's a lot of laws currently on the book, both telling pedestrians what to do and also telling vehicles what to do or not to do. And they're really the things that we take for granted and that we train our kids and that we test when we put individuals through driver services to make sure that they're safe to be on the road and to make sure that the pedestrians walk. If you flip over to the next slide, then really there's some statistics, and some of these are really worth taking a look at. If you look at the bottom left, you'll see, you know, there's a lot of crosswalks and school zones and traffic signals in our state. If you look at the top right, there's the stats from 2021. Probably a couple things to point out. One, pedestrian means more than somebody walking. It would also mean really roller skates, wheelchairs, really some sort of really non-mechanized type of a maneuver. We did have 12 fatal injuries of pedestrians in 2021. And I, you know, those all come across my desk. I reviewed them all before you come up here, and there's a tragedy behind each one. Interestingly enough, statistically, about 50% of those involved either alcohol or drugs. Many of them involved people crossing, you know, multiple lanes of traffic at night. And so very different from, you know, crossing school zones and in crosswalks. You can see that most of it happened in urban areas, which you probably expect. And about a third, a little less than a third, were in identified crosswalks. And most of them, well over half, occurred in daylight. The bottom right of the slide, I did ask the staff to say, hey, listen, now this is, you'll notice that's more than 12. That is it for in the year 2021, we track all safety incidences or accidents on the road. And that's all of them that involve pedestrians. And I was really interested in, talk to me about age group. And as you look at that, it was really actually interesting to see that, you know, certainly under 14 was high. And then the one that was equivalently as high was 55 to 64. And so that just sort of jumped out as, that's sort of interesting. and actually, more events probably for mid-age than elsewhere. So there's some stats. Let me just maybe talk to you about the next slide. When you get into this discussion that we'll have about crosswalks is, hey, who owns the road? And because the person who owns the road, that's who's responsible for really the safety that goes on that road. And you'll see that there is 30,051 miles of road in Wyoming. And YDOT is responsible for 6,733, or 23% of the roads. So we're happy to be here to discuss, but certainly Mr. Riemann and the counties and our municipalities have a lot of miles of road in terms of responsibility. With that, if we go to the next slide, I want to just stop here because it's important to recognize in life that sometimes, you aren't an expert in everything. And I am happy today to really pass this brief to an expert on traffic safety. And I'd like to introduce to my right, Miss Michelle Edwards, who is our district traffic engineer from District 4 or Sheridan. And I'll tell you, when we
lot of detail here, but just to kind of let you know that, our goal when it comes to pedestrian traffic control is providing it at locations where motorists aren't expecting there to be a pedestrian. Maybe that is a complex or confusing crossing or a signalized intersection where there is a lot more pedestrian traffic. That's really where we want to focus on. We'll go on to the next slide where we kind of jump into different types of crosswalks. Mid-block crosswalks would be just kind of what you expect, something that is not at an intersection but falls mid-block in between intersections. Grade separated crossings may be warranted where heavy volumes face unusual risk. So with all crosswalks, specifically grade separated crossings, the effectiveness of them does really depend on that pedestrian's perceived safety against the extra effort. So what we're saying there is that a pedestrian is going to take usually the path of least resistance. We all do. It's kind of our nature. So unless that crosswalk is in a spot that is along our path and makes sense for us to take, we may not go down 2 blocks further to another location to cross if we want to cross right here, unless we really feel that this is an unsafe place to cross, which you may feel. And that's definitely where a grade separated crossing could come into play. If you feel unsafe and it makes sense for you to go out of your way and take extra time to go to that crossing. Looking at the next slide, on slide 8, we'll get into the type of pedestrian crosswalks of school crosswalks, which is kind of the meat of today's topic. One of the things we will start to look at when we are asked about a school crosswalk would be, this talks about a gap study. So that is basically just looking at, we'll observe at the roadway, how many gaps are there available to a pedestrian as they are wanting to cross the roadway, and are there any gaps in the traffic for them to make that crossing? And if so, are there enough gaps compared to the number of pedestrians that are there? What would that delay look like to the pedestrian? How long will they have to wait to wait for an appropriate gap? And then additionally, we highly encourage school districts to complete designated school walking route plans. So looking at the areas around the schools where the residential developments are leading to the school and setting up a plan. We always encourage those plans to be submitted to us at YDOT and look at those. And if it makes sense that the school's walking route plan has a location that we need a crosswalk at, then it's something we look at as a part of that process to determine that makes sense for a crosswalk if it's a part of the route plan. It does note there that we do not encourage at all designated school crossings on roadways that have a speed limit of 45 miles an hour or higher. That is just not a safe operation. We don't want, especially school-age children, crossing on those high speeds. Those gaps are harder to gauge, and it's a longer time for vehicles to stop at that higher speed.
Can I ask you, maybe this is coming in your presentation, so with those higher speeds or even the potential for higher speeds, which is equally an issue, or are there other pedestrian accommodations that might be more effective, such as a sky bridge, or I don't know what other options there are beyond the crosswalk? But I know when I drive on I-25, there's one over Wheatland, for example.
Yes, Chairman, you are correct. There are lots of different types of options out there. The safest, I guess, would be that type of a sky bridge, and of course on that situation of the interstate, you would not want pedestrians crossing the interstate ever. So that is the best option for there.
Sure. Now, what about in an urban setting? You mentioned earlier there are highways in Wyoming that we may not recognize as highways passing through the middle of a city. Are there any in Wyoming sky bridges across any highways? Pedestrian bridges.
Yeah, yes, Chairman. Actually, I had written this as an example, and I didn't mention it. Right through downtown Sheridan, if you're familiar, that main street is a YDOT highway, and the Best Western has an overpass. They actually do call theirs a sky bridge, but you're correct that the pedestrian overpass is the correct term. But interestingly enough, that is a situation where we often see people not utilizing it. So I believe the Best Western, and I don't know when they installed that, many years ago, but they have second floor rooms, so that Skybridge connects those second floor rooms. You very often see the first floor tenants of that motel just kind of playing Frogger across Main Street, to put it lightly, where they are not utilized, they don't want to go up the stairs and over and back down, and so they choose to.
But maybe that's a little bit different example because it's privately owned and it goes straight into a hotel versus.
Correct.
If it were public, I would assume there would be maybe even an elevator, like I experienced in Las Vegas.
Mr. Chairman, I might add that Mr. Chairman, what I might add is one of the examples that Michelle will walk us through in her sec is a place where actually we are considering one, City of Cody. So I think.
That would be helpful, actually.
Yes.
You can jump to that. That'd be great.
Yes, Chairman, we can move, and yes, we will get to that. Actually, I'm not sure if the Cody one is an overpass, Director.
Just being considered.
Yes. Oh, okay. I was not aware of that. And I should give the caveat that, as the Director mentioned, I am just the Northeast Wyoming District Traffic Engineer. So sometimes when we get out of that area, that's not my area, but we can always set you up with the local expert on those areas if we have questions on those.
Well, that's what we'd like to know. If so, do you don't have that in your prepared report, or you do?
We do, yes. If we flip to slide 12.
Okay.
Is the example for the Cody situation, and I have some notes here. So in this situation, the biggest issue is that most of the housing and residential here is on the north side of, this is Bighorn Avenue, Highway 14, going through Cody. The housing and large subdivisions on the north side. The middle school is located on the south side of this street. So they are, as this mentions, they are currently doing a testing of this throughout this fall season. And some of the reasons we really wanted to test this and make sure it works before installing it permanently is that this is a 5-lane roadway, and I don't have it, but I believe it is a 30 or 35 mile an hour roadway, so not high speed, but still 5-lane. 30. Okay. Yeah. Thank you, Senator. So some of the issues with that 5-lane is when you have a pedestrian standing on the side of the road wanting to cross, there is what we call the shadowing effect, where the vehicle in the right lane will probably see that pedestrian and stop. But then there's a vehicle in the left lane that is being blocked from the sight of the pedestrian because of that car that is stopped in the right lane. And vice versa, the pedestrian can't see the vehicle coming either, so there's a sight distance issue there. So that's definitely a concern when it comes to a 5-lane. Additionally, with this roadway having an east-west alignment, there's concerns about during sunset and sunrise, when the sun is in the driver's eyes, of also not being able to see the pedestrian. Another thing that was looked at as a part of this is that Robert Street that is on the north and Freedom Street on the south, they're offset. So that creates a lot of turning movement conflicts where there are just kind of a lot of movement, but they're not together. Like we like to see intersections lined up right across from each other. That makes everything cleaner. Everyone can see where they're going. Makes for much better when you need a signal someday. So that's a concern in this area. And additionally, that Robert Street does not have any sidewalk or ADA accommodations leading to those housing developments on the north side. So that is something that I kind of skipped over, but something we really look at, especially when it comes to school crossings. We want to make sure that the existing infrastructure is around it, sidewalks, ADA ramps. It's not really appropriate to put a crosswalk that does not have then a sidewalk next, with it. It's encouraging people to walk along in a place where it may not be safe to walk.
Director, the funding on a project like this, is it unique? Is there access to special federal funds when you're doing this, or does it just come out of your general highway?
Mr. Chairman, actually, if you flip over to page 14, to slide 14.
Okay.
There's the funding for this there is some specialized funding that's available. And remember that the funding would always go with who owns the road. typically then in a partnership with the community that you're in. And so the funding program that we typically talk about is the transportation alternative programs. And you can see that the eligible entities are there in that bottom portion, and there's a lot of people that are eligible. The part of that process is always to have a plan. And going back to one of what Ms. Edwards really talked about there in Cody, as we work through that issue there, it has been fascinating to really look at some of the options that are out there. And really, the key for me came back to the encouragement of community planning at the earliest phases to try and avoid the conflict. And so it's just, having a school on the south side and all the people living on the north side, now we got to work around it, right? So, but it is what it is. If you flip over then to page 16, here's maybe just a couple comments on that, on the specifics of that plan. One is we almost doubled the amount of available funding in that plan this year as a result of IJA, because of the focus of this current administration on bike ped and alternate means of transportation. So at a time of, hey, what are some funding for different options, this is actually a good time to be looking at it. So about almost $10 million available this next year for, this transportation alternative. So think bike paths, crossings, that type of stuff. Now, I sort of skipped over the sort of flow chart, which was on page 15, but just think about, hey, there's an application process, we evaluate the applications, and then the award is given. In terms of the applications this year, you can see the stats. We had 34 applications from some sort of governmental agency of some sort. About $24 million worth of applications for our $10 million. 16 of those were in safe routes to school projects. So those always sort of bubble up in priority for us. We do rank all the applications. You can see what that is in the middle. What I'll tell you is I instructed our team to focus on urban, bike ped, and with a focus on getting people to school safe. All right, because I think that's really what we're interested as a state is safety of our kids. And I'm more focused, and I've worked this with our with our state pathways as well, as more focused on in urban areas than between communities per se. And then we do have an office that is run by Miss Sarah Ellis, and we call it our local government coordination office. She's really the point of contact and is out, deals with counties and municipalities extensively, and is, at WAM and WCCA. I'll tell you the other good news with transportation alternatives is that this year the match is 90-10. In previous years, the match was 80-20. The other rule that we have instigated is no project until you have a plan. All right, and so a lot of our focus this year is, hey, I want you, as whatever entity is applying for this, to make sure we have a plan going forward. So, because I think we need to be deliberate and thoughtful about where we're going. Mr. Chairman, that's, we could talk longer. I might just suggest maybe taking a quick look at slide 17. There is a program that's come back now, Safe Routes to Schools, and it was really in some past administrations a focus on it. Sort of disappeared for a while. It's back in this 2022 IJA bill. It didn't come with any funding, but it is allowing us to help. I think we'll start working towards some of that funding, and certainly provide some focus for us as we start looking at that. I tell you, from our perspective, if you go to slide 18, we will certainly continue to work with available funding and work closely with communities and make sure crosswalks are going to be. It's complex. We have a whole panel of experts working through us. They saw what was going on in Cody. I think that's a good case study. We had a close call there 2 years ago. A young lad crossing that street. And like so many things today, we did catch it on video. And, he sort of looked both ways and he ran across, and there's a truck coming, a tractor trailer, and that was following the speed limit. And he saw the kid coming, he hit his brakes, but he hit the kid. The kid fell over and then ran off to the middle school. So so then the trucker pulled over. We thank him for doing his duty, called 911, and the police came out and went and found the kid, make sure he was good. But that started the dialogue. And the first thing that we did was co-fund a study with the community of Cody and said, all right, let's talk about what we want here and what's best. We did look at separated grade crossings. To Miss Edwards' point, it's tricky there to put in an elevated one based on right of way on either side. And her point about the kids may not walk down to the crossway to go over, right? And so to some extent, you might have to put fencing up or something like that, almost like wildlife, to drive the kids to go over the crosswalk. Underpasses are always another option. I think most parents would prefer an overpass than an underpass just because it's probably less scary. But Mr. Chairman, I think at this point, we had some other examples in here, but I think if this has scratched the itch, we'll stand for any questions that you might have.
Well, Director, I think just 1 second, Senator Cooper. Director, I think your presentation is very much appreciated. I think you're spot on, and really appreciate the example of Cody and trying to be, I guess it is somewhat retroactive, it's responding, but it is also being highly proactive. And obviously if money weren't an issue, building, and I think this is true for the counties and the cities, not just your 23% of the roads, but if these were built in every area where there was a school on a busy road, whether we're talking about just crosswalks in general, but I'm talking more about these pedestrian bridges, especially in highly urban areas. Obviously, it may not be successful in getting 100% of all kids to utilize it, but the more that you utilize it, the less the risk level goes down. And so I think, I don't know, obviously I don't know if you're familiar with the example that is the genesis of the legislation that we have in Cheyenne, but obviously that's not a state highway, right?
Yeah, Mr. Chairman, we are familiar with that, terrible tragedy, absolutely. I live in Cheyenne and my kids have gone to school there for years. And so it's something that you never want to see. Now, certainly you're correct, not our road, but we live in the community and we operate in roads and work closely with, local authorities in terms of, hey, where can we go?
Yeah. Yeah, I mean, in your example of Cody, I think of Yellowstone Highway or not Yellowstone Road in Cheyenne, and it's about the same. It's 5 lane,
Mr. Chairman,
right?
you're correct. There's many roads in Wyoming that are the main street and that have school crossings on them. Buffalo's in here is another example, and Manchester, and the list goes on. If I may, I'll tell you another success story in this.
Yes.
Highway 22 in Teton County is we're in the process of this next year building 2 underpasses to connect a pathway there. And again, that is the most congested 2-lane road we have in the state. Not safe for pedestrians or bikes to pass. And as we worked with that, and that's certainly one of our roads, as we worked with the local authorities, pushed very hard to put in underpasses, and that's, it'll happen. And so certainly a focus of ours, a little bit different than the bill and the focus on schools.
Sure. Senator Cooper.
Thank you, Mr. Chairman. Director, I don't think we talked anything about the process for these entities to apply for these crosswalks. A constituent came to me just a week ago, shortly after school started, 2 weeks ago maybe, and said, what do we need to do to get a crosswalk? We did the Safe Route to School program years ago, and it never got finished up because we never got crosswalks. We're talking Highway 16, a lot of trucks, a lot of tourist traffic. Yeah, maybe we got 6 or 8 kids that live on the other side of the highway, but those 6 or 8 kids deserve the same protection and the same ability to get to school in a safe manner. And sometimes through Ten Sleep or through Matiti, that highway it's more like a racetrack than it is a residential area, if you will, or a business area. So what's the process? When this person went to the town and asked, they asked me and I said, I'm sure you go to YDOT. But they went to the town and asked, and the town said, good luck with that. We've tried several times and we haven't got anywhere. So what is the process? How do we make this happen?
Mr. Chairman, Senator Cooper, here's the process for a crosswalk like that. Is for you, I'd like to call Mr. Pete Halston, who is the district engineer, and I'll get you his number afterwards. But when somebody comes and asks about, hey, we want to put a crosswalk on town X or town Y, I always send them to the district engineer. You have 5 of them. I just had recently the question, I think it was in Glen Rock. And again, so Mark Ain is our engineer there. And we'll get you started there. Now that's so we'll take a first look at it. Because if it's a crosswalk there, then if it's something easily done, you start going through the analysis that Miss Edwards talked you through. And you start going through the flow chart. Hey, is it warranted? Is it not? If it is, what makes sense for us to put in? And then what's the funding source? And so if somebody asks, will the solution be, hey, let's go paint some lines on there tomorrow? It may not be, because the lines by themselves may not be enough. And what we always want to avoid is that false sense of security that a young man or woman may get as they walk across there, and we don't want to set the conditions for a tragedy there. So it will start the study. I would hope it's more than good luck. In fact, I know that's not an acceptable solution, right? But we'll get you Mr. Halston's number. And for all of you on here, your district engineer in your area, that's the person I hope you have on speed dial, because that's my boots on the ground representation for you. And when something happens in your communities, that's the first person I send you to. Mr. Cooper or Senator Cooper, is that?
Yeah, I'm still not sure the process. Contacting the district engineer hasn't worked in the past. So what's the next step up?
Mr. Chairman, Senator, I would say if that doesn't work, you got to call me. So, and then, I mean, that's typically how things work. And now I would like to go to slide 15 just for a sec, in terms of process, because if it's for certain type of projects, then the process, and we sort of skipped over this is the process to apply for an alternate transportation grant. And so you can see there's some suspense dates, and there's a formal process that we follow to try and fund the priority projects around the state. So if your crosswalk would be eligible for the transportation alternative, then that's where we would go. Typically crosswalks, unless you're going to build a big, overpass or underpass, it's probably something we wouldn't send you to transportation alternatives for. As the chairman indicated earlier, sometimes we'll just fund this. If there's a safety issue, we'll always fund it. And so the issue then becomes hey, is it warranted or not? And that becomes a discussion of our professional engineers and the city fathers, city leaders.
Vice Chairman Washut.
Thank you, Mr. Chairman. A question for Interim Colonel. When we're talking about these types of crashes, they're often caused by distracted drivers. And obviously engineering can take us so far, but then we need enforcement. Can you talk a little bit about the enforcement side? How frequently must law enforcement be present at a location to have a significant impact on driver compliance with the codes in that area?
Sure, Mr. Chairman.
Shannon Ratliff with the Highway Patrol. And Representative Washut, that's a good question. Those are typically activities or locations that you just about have to camp an enforcement officer at that location to watch driver behavior, pedestrian behavior, and to be able to do anything. Most often we hear about something, a close call afterward, and we don't have anything. We don't have a vehicle description or the child's name, et cetera, et cetera. So it's difficult.
So when you say you basically have to camp an officer there, what I take from that is that most agencies, most communities aren't going to have the resources to supply law enforcement officers to school zones and crosswalks to come anywhere close to motivating drivers and pedestrians to conform to the codes. Is that right?
Mr. Chairman. And Representative Washut, in my experience, you're correct. Most agencies don't have those sorts of manpower resources, especially today. What typically happens is those high priority areas make it to the top of the list. The supervisor will provide that list to his work group, and they'll typically rotate through those areas as they come to the top of the list. But you're correct. We simply don't have the resources.
Guys, Senator Kolb.
Thank you, Mr. Chairman. Director, in particular, when there's a fatality, does YDOT reach out to those communities where that fatality happened, say in a school crosswalk? Do you have any conversation, or just how would that work? Do they reach out to you? Could you please explain?
Director?
Yep. Mr. Chairman, Senator Kolb, maybe I use this recent event in Lander as an example, where we had the child hit in a crosswalk. Certainly, our team was there within the next 3 or 4 days, talking with the city about, hey, did that thing work the way we want? Is there something we can do better? Is there something we want to change? I know there's a follow-up meeting that will be coming. And so every fatality is looked at and examined, and the appropriate follow-up taken. Let me maybe see in terms of some specific examples if our colonel can answer that, if you're good with that.
Mr. Chairman, I can't think of any specific examples. Most often, especially in the smaller communities, if there is a fatality, the patrol gets called to assist with and God forbid it's a fatality, but to assist with investigation with our equipment and our training. And then that information will trickle up into the YDOT realm and generally into the local YDOT group there as well. We all work together as a kind of a united front when these sorts of things happen.
Got a follow-up? Yeah.
And when would you put in a pedestrian bridge? Under what circumstances? I mean, I think when you have a fatality, that's pretty bad, and it might really raise the bar a bit in my mind. But what raises the bar in your mind to the point where we need a pedestrian bridge? I mean, granted, with the challenges it might bring with people walking around it, but I think we just got to do what we can do to protect the young people who are young and they don't look like the rest of us might.
Mr. Chairman, Senator Kolb, I'd like to pass that one to our traffic engineer.
Ms. Edwards.
Chairman, Senator Kolb, I think you're absolutely right. We do have to look at these things with a close eye, and also keeping in mind cost and if it's feasible in that location, like you mentioned, it may not be a location that makes sense that it can be built, right? There might be houses in the way or whatever it may be. You know, I think another thing that the director mentioned earlier is really looking at how we direct the children to make sure they're utilizing that. Depending on the location, if it makes sense that we can put up fencing to block crossing across the spot where they all want to cross, right? Or, you know, we've done some work with schools too. One example is in Manchester where they wanted a crosswalk in a spot that maybe didn't completely make sense at first to the children, but the school did a really great job of educating the children that this is where we're putting the crosswalk. It was one with a push button activation and then would flash. And they made sure that the young kids coming in, the kindergartners down to that level, were taught to push that button, look both ways, because also that false sense of security, we wanted them to understand that just because you push the button doesn't mean you can just run and go. So I think there are a lot of things that we would look at and would want to make sure that it is a pedestrian bridge that would be utilized to its full extent, correct? I mean, if it's a location that is for one house, does that cost make sense to put a bridge for one house, or is it really a safer option for that child to be driven across that road if it's not a safe location and they should be crossing over the highway? So a lot of factors to be looking at there.
Representative Provenza.
Thank you, Mr. Chairman. Director, you mentioned the number of school zones that are in your purview. I imagine you don't have too many that are in the 45-mile-per-hour plus zone, if you have any, but I'd be curious on what the number of those are, or perhaps 5-lane crossings. And then if you do know the number, how I can access the number of those areas where that might be in city purview. So trying to understand where do we have these high-risk areas, because we know they exist. It sounds like there's a couple places in Cheyenne where there's a 5-lane crossing. So I'd just be curious, how many would we foresee as being kind of like in the orange?
Mr. Chairman, Representative Provenza, hey, that's a great question, and I don't have that number off the top of my head, but we'll certainly work to get that to you.
Representative Yin.
Mr. Chairman, thank you. Director, I appreciate the note that you said that the administration, the federal administration, is upping the grant from 80-20 to 90-10, so that's great, and that they're focusing on school route to safety. So looking at the flow chart, it's normally a local sponsor that submits the application, and I'm curious on whether we as a committee could be the sponsor, as well as provide some of that 10% funding. Thank you, Mr. Chairman.
Well, now there's a question. This goes back to the judicial savings account I was trying to create earlier for our committee off of those court filing fees.
Mr. Chairman and Representative Yin, the 10% match can come from anywhere. So if the legislative body so chose to have a fund and to support the match, that's a great solution and would be welcome from our standpoint, and probably from local communities.
And Director, that could be a private match too, or a private public match together.
Mr.
Right,
Chairman,
anyway.
Absolutely.
All the, yeah, there's a lot of concepts. Okay. You know, with that discussion of local entities, do we have Mr. Frazier here? Municipalities, Wham? No? Yes? Oh, on Zoom? Let's get just along the same, we're tracking down a really good path here, I think, in terms of narrowness of the committee's thoughts. So Mr. Jeremiah, Mr. Nyman, you'll be, I think, up next, but I suspect that the bulk of the pathways that we want to talk about are going to be in the municipalities' jurisdiction. So
Thank you, Mr.
Director.
Chairman.
Thank you. Welcome, Mr. Frazier. We are obviously trying to wind our way down. I hope you've heard the discussion and you can kind of see where the interests of the committee are, and would really appreciate your comments in that area.
Thank you, Mr. Chairman. I appreciate that. I assume you can hear me just fine.
We can.
Great. Would you like me to proceed? I see Mr. Raymond's approaching the table as well.
Oh, I was just lining him up on deck so we can go.
Okay.
Yep, you're on.
Great. All right. For the record, David Fraser, Executive Director, Wyoming Association of Municipalities, and I appreciate the committee's time. And I appreciate the opportunity to be on Zoom today. I always prefer to be there in person, but I appreciate that. So I want to commend the committee for taking up this very important issue. It's of course very near and dear to the hearts of our members, as has been mentioned by some of the committee members already. As relates to the bill itself, the bill itself is a little outside of our purview. Those criminal proceedings would take place in circuit or district courts, not municipal courts. So the bill itself is a little outside our wheelhouse. However, the issue is important to us, and we're very interested, and we're also not uninvolved in these things, as you guys have discussed. In addition to the traffic engineering that you guys have referred to in terms of where crosswalks should go and other appurtenances, flashing lights, those kind of things, we are involved with that on all the streets that are city streets. We have an awful lot of coordination with YDOT.
Hey, Mr. Fraser.
Yes, sir.
Let me just help narrow you. So
Okay.
it sounds like the committee is understands all of that relationship and what you do and what you don't do. But our interest is highly in how we can build, what can you do and what can we do to help you build more safe pedestrian accommodations, particularly when we're talking about are in highly urban areas where the Cody example is the example where it came so close, too close, and so now we're building something, and that's the state highway, but we're now talking about the municipalities. And that is the genesis of our discussion today is a very unfortunate fatality that occurred on a municipality road.
Thank you, Mr. Chairman. Yes, and the event that you're referring to, which of course is not completely an isolated event, there have been some changes in the traffic pattern there. That's something that we can do to be direct with you in terms of the question you just asked. Funding is always a significant issue. Using the Cody example, there's been some talk there of doing an overpass or an underpass, and of course it's just a significant amount of money. In that case, we're talking about YDOT's budget, but there are also some things that, for example, in Metitsi, which was brought up earlier. Now this is third hand, but I understand from visiting with the mayor there that one of the issues with getting the crosswalk that they think they need there is the grade of the road that it's on. And apparently there are some engineering concerns about putting the crosswalk at the bottom of that kind of a grade. And if you've been through Metitsi, you'll have a mental picture of the significant grade coming into town. And of course, where they need a crossing is right at the bottom of there. And I know that there's some, that the local, I'm given to understand that the local YDOT engineer there, that it has concerns with vehicles being able to stop there and that kind of thing. So even at a place with lower foot traffic like that, it may be a more expensive solution that's necessary. And so funding is always, always an issue with that. We do try to do a lot in terms of prevention as well, of course, at the local level. But in terms of what the legislature could do for local governments, I think that I think both funding is always important, and also we have a good at WAM's level, we have really good communication with, the director of with Director Reiner and his staff. At the local level, we want to make sure that the communication lines are always open with those district engineers as well. So that's something that always can be encouraged. And I know that, and I've shared with my members that Director Reiner is very engaged in making sure that that the local needs are seen and that they help us with that. Again, I think resources are kind of the bottom line on that.
Yeah, thank you. Definitely agree. Resources are going to be that's the issue. I think we all want the same safety. It's just a matter of allocating resources when you have them and where they are. Committee, questions for municipalities? All right. Oh, okay. Vice Chairman Washit.
Thank you, Mr. Chairman. So, same question I asked the Lieutenant Colonel, maybe you heard it. Enforcement wise, municipalities often, if they're smaller communities, lower call load, they actually have officers available, I would guess, to do school zone enforcement and traffic enforcement and so forth. Larger places may not. Can you comment at all about availability of enforcement resources to complement any engineering changes that we might make?
Thank you for the question. Through the chair, to Representative Washit, we do, one of the things that scared me straight, I guess, when I was an early driver is that I had the good fortune, I now consider it, to get a speeding ticket in a school zone. And those tickets are very expensive, and that scared me straight. I've always been, since then, very thoughtful about my speeds in there. And one of the things that local governments do kind of as a best practice, and what we often do is at the beginning of the school year, the local government will really focus on those school zones and send the message early to the drivers that are in those school zones that those are, that they need to mind their speed. Speed, of course, is probably the biggest factor in these issues. So in the event that Director Reiner mentioned in Cody, he mentioned that truck driver was obeying the speed limit. And so even though there was a collision, obviously the child was okay. And that makes a big difference. I'm sure if that truck had been moving faster, there might have been a different result there. So we kind of most of the local governments try to hit that early. Of course, as there are different parents that are in the school zone that year than the year before, it's important to kind of draw those lines. It's a double-edged sword in the small communities, because they do have more availability for that, but they have fewer officers. Some of our communities only have one officer. Some of our communities are contracted with the sheriff's office. Interestingly, like so many other areas that are affected by the labor shortage, police forces, even the small forces that many of our communities have, recruitment is a real struggle right now, which is a side issue, but especially given kind of the environment in the country right now and the labor shortage, that's getting harder and harder to fill the positions that we have in the police force. But to answer your question, I think all of our communities apply as many resources as they can to the school zone. And like I say, an important practice is to do that early in the school year, and kind of overdo it a little bit early in the school year and send that message.
Additional questions, committee? All right, thank you, Mr. Frazier.
Thank you.
Jeremiah?
Good afternoon, Mr. Chairman, members of the committee. I'm Jeremiah Riemann here on behalf of the Wyoming County Commissioners Association again. I'll start off by saying that counties are responsible for approximately 53% of all the roads that exist in the state of Wyoming. We take our responsibility very seriously. If you'll just allow me a personal indulgence, this is an issue that's very close to me and important to me, and I appreciate you taking it up. The morning that Miss Jones lost her son, and that Mac, that young man that we all lost, I happened to be dropping my boys off at that very school. So this is very close to me and something that I would like for all of you to continue to work hard on, and I'm committed to that effort. Representative Washut, if I can very quickly, just to your question, that particular school zone, right at that very crosswalk, every morning is a Cheyenne Police Department cruiser, every single morning, and that happened before that incident. And unfortunately, we had the accident that happened. It's too tragic. I don't know that that's the perfect solution to this issue. It's a much bigger issue, and I think we can collectively work towards it. As part of that personal indulgence, I did a couple of things. One, I sent you a report. That was a report that the legislature actually called for and funded. It was the 2018 Bicycle and Pedestrian System Report. I called that to your attention because we've taken a look at this at a very specific level from a very dedicated team to try and come forth with recommendations. And in that report, I'm going to just pull my report up to page 6 of the document. It has 3 specific high-level recommendations that group recommended to the legislature. They made recommendations to others. They also made much more extensive recommendations to the legislature and others that are found in the back of that report. One of those recommendations was an in-depth interim study, so I'm glad that we're doing that, even if it is 4 years later and following a tragic accident. The second one is one that calls for the creation of a fund for $10 million for bicycle and pedestrian infrastructure across this state, an annual investment on behalf of the state. You've heard some of the funds that are available at the federal level. That requires a match. This could be used as that match, and perhaps we could maximize or accelerate what we could take advantage of at the federal level. The second part that I wanted to just draw you to is that I think some of you know that I have a very personal interest in mountain biking and trails in this state. But I'll tell you, from my perspective, the first place that trails start is safe pathways to school. Starts there, then it builds out into the outer skirts of your community, and then, of course, in the wild areas where I really enjoy going to ride. And so as part of that, as your joint TRW committee is working on that particular issue, just a couple of weeks ago, I presented a 9-page report to them, which details 53 or 52 examples of different funding mechanisms that are used across the world to invest in outdoor recreation, trails and pathways, and safe pathways to school. And as I mentioned to that committee, one of my interests is in, and perhaps my top priority amongst that, is to dedicate funding, maybe it's this $10 million, towards safe pathways to school. So I would just ask that you watch what that committee is doing. They're preparing several bill drafts for their next meeting with, I hope, the intent of bringing out a bill that will invest in these sorts of things. And maybe you could partner with them on the safe pathways to school element of this. Mr. Chairman, with that, you've gotten the depth of my knowledge around this issue. And so I asked one of our experts in this state, Mr. Brian Edwards, who is the Park County engineer and also a leader amongst his colleagues within the state, to come and speak to you from a county perspective. And so with that, I'll turn it over to Mr. Edwards.
Had to figure out that green light there. Again, I'm Brian Edwards, Park County engineer from up in Cody, so I'm very familiar with the Cody situation that we've been discussing on Bighorn Avenue. I serve on that committee with the city of Cody, with YDOT, the school board there, so very familiar with that. In addition to being a county engineer, I'm the state president for Wyoming Association of County Engineers and Road and Bridge Superintendents, and I'm also the state director for the National Association of County Engineers. Just a little background. In looking at, or coming to talk to you today about this, Jeremiah had asked me to to attend and provide some backup. I reached out to my counterparts across the state to try to get some input from what they're seeing in the way of county issues related to crosswalks, and not just crosswalks. It's in the county side, it's broader issues of pedestrian vehicle conflicts, which means, you know, everything from like in our county, we're seeing more and more truck route conflicts with walking trails, biking trails, seeing a lot more of that type thing. But most everybody that I talk to is seeing some of the same issues, fringe areas with the growth. In the case of the Cody example on Bighorn Avenue, it's already been said, but you know, trying to fix something after the fact, you know, where the middle school is in place, the growth of Cody, there's a residential area that came after the fact, then how do you get these kids across the state highway to get to the middle school? So it creates some challenges. So in talking to the people across the state, other county engineers, some of the limitations that I've heard are echoing what was said on the municipalities. Funding is always an issue. That Transportation Alternatives Program is a very good program, and especially dropping the match to 10% has been attractive. I want to say I talked to several counties, and every one of them that I talked to is either interested or applying or has applied for transportation or for alternative TAP, for the TAP funding. And I know Park County, we've actually applied last year and was granted a Transportation Alternative Program grant for the city of Powell for a pathway bicycles connectivity. If you're familiar with Powell, you've got Northwest College, Homesteader Museum, you know, the schools in there, you got housing on the west side, but then the way Powell's set up, we've got these truck routes, and so you've got these crossings and people walking and biking and the connectivity of that. So what we submitted was an application to study a plan to basically add on to the city of Powell's pathways plan to look as Powell's growing to the west and to the north, how can we avoid some of those conflicts? And so we completed that plan last year, and now we've applied for some funding to do some actual infrastructure changes to address those. Some of it involves crosswalks, some of it involves pathways. But so this is not an issue that's foreign to counties. We definitely are seeing more and more issues. One of the other challenges we get into is it might be a call from one person that wants to see a crosswalk in a certain place, and it just, you know, may not be justified, and how you balance those, because as everybody said, every life's important. We don't want to see any fatalities or any issues or even near fatalities. So we try to do our best to avoid those, but then there's you know, driver inattentiveness, and then the pedestrian inattentiveness also that is sometimes difficult to plan for. But in the end, I think talking to the counties, not in addition to the funding, one of the other issues I heard was expertise. You know, when it comes to dealing, you know, issues were brought up about, you know, what's the process and how do you go about addressing these? Because for some of these that don't involve YDOT, and I can say in my district, I've got my district engineer, Mr. Halstead, and my traffic engineer, Jack Hoffman, on speed dial, because he's helped me through a lot of issues that I may not have the expertise in, that he's helped me give some recommendations. So I think that relationship with YDOT at the county level, I'm sure the municipal level also, is critical. There's, like in Wasters, there's less than half of the membership counties have a county engineer on staff, you know, so they may contract that. So that expertise and that relationship with YDOT, the funding, LTAP plays a huge role in training and providing traffic studies for those that can't or don't have that expertise. So that's a big issue. Other than that, I do think it's an issue that we're going to see more and more problems with, and definitely the county's not a stranger to that. Other than that, I won't repeat what other people have said, and I'm available for questions.
Vice Chairman Washit.
Thank you, Mr. Chairman. Mr. Edwards, you made the comment about school being built and then a subdivision being built and the connectivity between the two. Is it not possible to, as a condition of licensing, permitting, platting the subdivision to require that they put in that connectivity at the cost of the developer as opposed to the taxpayer?
You know, that's a very good question, and I think in some cases that can be done, because I know on the county level, a development, part of our road and bridge standards is that the developer is responsible for upgrading roads, which would include that kind of thing. So I can't really speak to the municipality side of it on the incorporated areas, but I would think that there would be something there. And some of these are just older areas that have been zoned that way, and then now they're developed, and maybe they were even older subdivisions, but just now are growing and being filled out and built out. And so those issues are coming to the forefront now.
All right, thanks, guys.
Thank you.
Please.
Dr. Reben, Mr. Riemann, is there, did the travel committee, did they do a bill draft for that $10 million funding program?
Mr. Chairman, Senator Narcotics, the TRW committee ultimately sponsored a bill that started out in the House last year that would allocate $40 million towards pathways. It's a one-time appropriation. I think they put in the $40 million as a placeholder. That said, in addition, they established a small working group, which I'll be a part of, to try and develop a couple of other alternative funding mechanisms that are intended to be more long-term sustainable funding sources rather than just a one-time general fund appropriation, if that makes sense.
Mr. Cook, and is that working group intending to address the concerns we've heard today, or is it possible that it could?
Mr. Chairman, a great question. I would say it's possible. My presentation to them was that they focus on 4 areas, say pathways to school, and the other all deal with outdoor recreation elements. So I think there is an interest. Obviously, the Senate co-chair there as well has a son that goes to the very school that we've been talking about. And so she has a personal interest in this. And so I do expect that it'll have some component of safe pathways to school. And I tried to impress upon them that when we're talking about outdoor recreation, first place you start is at school level and then build out.
Make sure you tell the Senate co-chairman that I think the prison savings account has $10 million in it. Just a thought.
Thanks.
All right. Public comment. If you'd like to, yes, please. And while you're making your way up, Mr. Fuller, who do we have online? I know I think all of the YDOTs were supportive of what we've already passed through. So what's online? Anything? Nothing? Okay.
Thank you all so much for having me back again. For those of you who don't know me, my name is Janelle Jones, and it was my son, Mikhaili Evans, the community knows him best as Mac, who died on the crosswalk at McCormick on November 5th of 2021. And I'm here today, obviously, to discuss the bill that was presented. And I think that there's a couple of concerns that I have, just as a parent, just as a concerned citizen. I can tell you that I have spent multiple days since school has started on the crosswalk, volunteering my time at McCormick Junior High, helping assist those children across the street. And I can tell you firsthand that it's not the children I'm worried about, it's the drivers. And so again, the children getting to school, we can provide those routes, and that's wonderful. But watching the drivers through the school zones and the lack of enforcement that is there, not because that they can't be. I've been told, and I actually today have left a message for the chief of police in Cheyenne to ask him to come out and join me on the crosswalk so he can see firsthand the challenges that I am facing daily. I have not lost my mom voice yet. I'm out there every day yelling at drivers and telling them to slow down because we've got a 20-mile-an-hour school zone and people are going well over 20. It's like a suggestion to them. I've been almost hit twice since school has started on that same crosswalk. So I've also been out there discussing the impacts of distracted driving with the students at LCCC and the driver's ed classes. And I think that just educating these new drivers coming through on the importance of not driving distracted and what those consequences can look like. And so again, I'm asking on the penalty level to consider making this a felony offense. And I know last time we had discussed and we came to the conclusion of that it would be discussed on the crosswalk or school zone level, not across the board. And I completely agree because crosswalks and school zones are two places where people should be implementing the most caution when driving a vehicle. And that we all know a person is no match to a vehicle. So vehicles can be a weapon if you are not driving it properly. And so to go back to the penalties portion of this, our law states right now that the penalty for vehicular homicide is no more than 365 days and or a $2,000 fine. And just to recap from the last meeting that we had, I had pointed out that reckless endangerment also carries the exact same sentence of no more than 365 days, but the fine is only $750, which means that the difference is only $1,250 in this state of Wyoming. So then you go on the contrast on the opposite scale, and aggravated vehicular homicide carries a sentence of 15 to 20 years. And so the way I see it is that by us increasing the penalty to that, and I'm no lawyer, I have not gone to law school, so forgive me, but I'm just a person that's just trying to think outside of the box and think of, I realize that we've said that there can't be any deterrence, or that people won't possibly, not many people will see this as a deterrent. But I personally do think that we can educate drivers, and people have been shocked to know that our penalties are only no more than a year. But what I was going to say is that to fill in that gap or to allow a judge the opportunity to be able to sentence somebody more appropriately based on the circumstances, because every circumstance is different. And so when you have a situation where you have a pedestrian like Mac who was hit on a crosswalk in a school zone and he was obeying the law, he did everything right. And this is one of those rare instances where there actually was video footage that proves that he did everything right. And he still lost his life to a distracted driver that morning. So I just would like you to consider that, please. And, the thought, I know that the law feels very differently on this, but I don't see distracted driving as much different than drinking and driving. Drinking and driving, it's not a person's intent when you leave a restaurant or a bar to kill somebody, but neither is distracted driving when you're looking at your passenger or texting on the cell phone. Both aren't, it's not an intent to kill somebody, but we all know what the end result can be. And we as drivers are responsible, and we have a responsibility to pedestrians and particularly children in school zones.
Vice Chairman Washit.
Thank you, Mr. Chairman. Did the police officer who's on duty at McCormick every day witness the collision that took your son's life?
Thank you. No, there was not an officer on duty there that morning. And I can tell you about half of the mornings that I've been at the school so far, there has been an officer, but only about half of the time. And it has been told to me that there's just not enough enforcement available to help at the school.
Committee, anything else? Thank you, Ms. Jones. I think, obviously this is the second time you've appeared in front of our committee, but I still want to express, it's not easy to come and testify about this. And I think the issue is it's obviously very personal to you. I'm a father of 3 kids. And when I read about instances like this, what immediately flashes through my mind are my own kids, right? And so, and I think that's probably true for every parent, that they spend each and every day thinking about how to keep their kids safe. And as representatives of the people, that is our job here as well, I believe, to ensure public safety. And so I don't think anyone on this committee has any doubt that they have a responsibility to ensure public safety, and deeply empathize with you.
Thank you.
Thank you, Ms. Johnson. Co-Chairman.
Thank you, Mr. Co-Chair. Ms. Jones, it's wonderful to see you again, and an inspiration for all of your courage to be a voice for MAC, and to have the courage to show up at McCormick every morning and protect other people's children, to make sure that doesn't happen to them. And to see our community covered in balloons at the start of school, to remember to slow down in school zones. And know you will always be a voice for him, and he will not be forgotten in our community. So appreciate all that you do, and the time that you have taken, and the courage you continue to show. An inspiration to all of us, and a reason for why we choose to serve and serve each other in a way that we do. So thank you.
Thank you so much.
Any additional public comment? Yes.
Michael Akusik, representing Wyoming Pathways. I know we're way behind schedule. I'll just be very brief. I sent a copy of a 60-page report to this committee on price options and cost report for crosswalks that showed varying amounts of money needing to be spent relative to other ways of spending money, because the data is not exactly current, but I believe the relative costs are reliable. I've also shared this report with members of TRW and Director Reiner. And what I would just like to say and point out as a suggestion to the committee as you're considering your work, every time we replace or upgrade a road, we build in, I think as Representative Washut may have mentioned, upgrades that include bike lanes, crosswalks, ADA, ramps, appropriate sidewalks. In Lander, where the young gal was recently hit, I believe she was on a bicycle crossing on a crosswalk. Driver hit and dragged the girl, lost use of her right hand, and respondent was saying that, well, the sun was in my eyes because they're facing east. And there's many ways we can prevent that. I have a daughter too who was in a bad accident when she was little, and it's just, it's hard to imagine that we can't find ways to fix it and make it better. And so this is available. I think the combination of the work with TRW, which I'm also advocating for some other projects with, would be a great solution. And if you have any questions about this now or at any time, I'd be happy to help and answer those.
Thank you. Yes, the report, very helpful. I've passed over it, and I've been passing through it throughout the meeting as well. I think I'm really looking forward to the work of TRW. I do hope something comes from that. I think most of the committee shares that same opinion, that's a real solution to provide more safe pathways throughout Wyoming. And it's not our committee, obviously.
Right.
So unless we use the penitentiary savings account, then it fits in Judiciary, but otherwise.
It should be in transportation.
Oh, yes, it should actually be in transportation. Yeah. That's a good committee for it too, but thank you. Committee? Questions?
Thank you all.
Thank you, always. Okay, any additional public comment? Okay, closing public comment. Committee, what is your pleasure? Representative Yen. Oh, I'm sorry, I didn't hear you. Oh, moved by Senator Cost? Not Kolb, just for clarification. Okay.
Second.
Seconded by Senator Nethercott. Okay, discussion on the bill. You have an amendment?
Yep.
Okay,
There's a staff comment in there to move to allow for this particular provision to be expungible.
okay, that's been moved by,
So I move that,
moved by Senator Nethercott to include the expungible language, seconded by Representative Swanitzer. Discussion on this amendment? All those in favor of the amendment signify by saying aye. Aye. All those opposed? That amendment carries. You have any other amendments, Co-Chairman? Anyone else have any amendments? How about comments? Vice Chairman Washit.
Thank you, Mr. Chairman. As I said in Lander, I just have a hard time thinking about talking to a parent whose child gets off a school bus and is going across traffic and a car comes past that school bus with the flashing lights and strikes that child. And we say, well, that's different than if your child had been hit in a crosswalk at school. So it seems to me that if we're going to address vehicular homicide, we ought to look beyond just the school zone crosswalk scenarios, that there are equally tragic situations. Imagine a texting driver jumps up over the sidewalk and runs over your child on the sidewalk. You know, you'd expect your child to be safe on the sidewalk. And so I just really struggle with this idea of enhancing the penalties for a very narrow category where distracted driving or whatever the cause causes the loss of life in these situations. So I'll probably be a no vote on this bill.
Representative Yin.
Mr. Chairman, thank you. I want this to happen to no one else's kid. I want this to happen to no one else's child, family. But I think just enhanced penalties by itself isn't going to help. I think for that specific case, I think it's clear that it's still dangerous. It's still a dangerous intersection, no matter, even if we pass this bill, I think it will still continue to be a dangerous intersection. So what I would like to see the committee do is actually do what I asked the director, which is sponsor a project for that specific intersection. I do think we need to have TRW's bill continue moving forward, and hopefully we can pass that and we can have more safe intersections across the state. But I would like us to do that. So I'll probably vote no on this, but I'll make another motion afterwards.
Committee. You ready for the question? Senator Kolb, were you just getting ready to vote? Or you just lit up
Getting
his
ready to
mic?
vote, Mr. Chairman.
Oh, so I just don't want to, I just want to make sure.
Oh,
okay.
Thank you for being.
Roll call, please.
Senator Cooper? Aye. Senator French excused. Senator Kolb?
No.
Senator Cost?
Aye.
Representative Crago?
No.
Representative Larson?
No.
Representative Oakley?
Excused.
Representative Provenza?
No.
Representative Washit?
No.
Representative Rodriguez Williams?
No.
Representative Yin?
No.
Representative Swanitzer? Co-Chairman Nethercott? Chairman Olson?
No.
It does not pass.
Representative Yin.
Mr. Chairman, thank you. I would move that we have a draft for our next meeting to sponsor a pedestrian bridge project for the specific intersection in Cheyenne, with the idea that the 10% TAP match would be 5% the state, 5% local entities. And that, I think the matching discussion is something that we should,
Second.
that it would be specific legislation to sponsor that project, so we make sure it gets done.
It's
It's special legislation is my concern.
Oh. So, maybe a question for Mr. Fuller, is there something that we can do that's a resolution from the committee to sponsor this, to create a plan to sponsor it for the TAP project?
Representative, you can do the same motion without it being specific?
I would adjust that motion to be non-specific to the location, but for a pedestrian bridge for a school zone.
Okay, it's been moved by Representative Yin and seconded by Co-Chairman Nethercott.
Mr. Chairman,
Please.
may I ask just for clarification? So the motion would be for direction to, I'm not sure who, direction to someone to apply for the federal funding, and the bill would provide, I think 5% for that 10% total. I'm sorry, Representative, I lost track of you mentioned a 5 and 5 split.
How about this, Representative Yen?
Sure.
Let's disregard the 5-5 split. Instead, I move for that the committee adopt a bill draft appropriating $10 million as a placeholder. We can debate the amount at the third meeting for the purposes of pedestrian bridges and school safety crosswalks, period. Give me a second.
I'll
that work,
second,
Representative?
yeah, I will second that. Thank you,
Okay.
Chairman.
I'm not sure whose motion that is now, but,
It's friendly.
Withdraw my previous motion.
okay. Representative Lorson.
Mr. Chairman, I remember passing something where we funded some passing lanes in 2 different highways. And was that not specific legislation? And I guess I wondered how we got away with it back then.
Well,
I'm sorry, Mr. Chairman, I would prefer we specify it.
It is unlawful to do that.
Yeah, I can't, Representative Lorson, I just can't speak to what other legislatures did with the Constitution.
I think, Mr. Co-Chairman, I think Representative Larson is asking, and I don't recall the specific bill draft. I'm assuming it might have been a budget amendment, potentially, in the budget bill for appropriating funds for specific highway?
Yeah, Mr. Chairman, Chairman Nethercott, I think that's correct. I think it was in the budget bill. I don't recall the specific language that was used to reference those projects. I'm not sure if it specifically called out that highway or if it used broader language.
In a budget amendment, you can specify specific projects. That's how that typically happens. So this would be different, and in order for it to be lawful, we can't do a special piece of legislation for a special purpose like that.
You don't need to second anything. I mean, you can, but it's already been seconded.
Okay, thank you.
Yep. Any other discussion on the motion? All those in favor, well, yes, this is a motion to create a bill draft. All those in favor of the motion signify by saying aye.
Aye.
All those opposed? It's adopted. Any other motions? That's it. Let's go home. We're done. Tomorrow, 8:30 a.m., this room, we will take up the rest of our topics.
Just a quick message to the members. Tomorrow morning at 7 a.m., anyone who wants to, Sheriff Harlan will be conducting a tour of the Natrona County Detention